remain muted at all times. Use the floor microphones. Wear face mask as all time. Occupy seat marked for the purpose. Or at all the time, maintain social distance and distance of at least 1.5 meters from each other. Delegates must switch off their video if want to speak and address the chair. Any delegate who wish to speak must use raise hands function. All delegates must participate in the discussion through the chat room. Honorable delegate, in accordance with Council Rule 2471, there will be no notice of motion or motion without notice. Honorable delegate, before we process to question 1, I would like to take this opportunity to welcome the Deputy Minister of Health and the Minister of Social Development to the House. Furthermore, I would like to make the following remarks. The time for apply by the Minister to a question is 5 minutes. Only 4 supplement questions are allowed per question. A member who has asked the initial question will be the first to be afforded an opportunity to ask a supplement question. The time for asking supplement question is 2 minutes. The time for reply to a supplementary question is 4 minutes. The supplementary question must emanate from the initial question. Honorable members, I'll now call on the health, I now call on the Honorable Deputy Minister of Health to respond to the question number 202 asked by the Honorable Gillion. Honorable Minister, Deputy Minister.
Honorable Chair, honorable members of the House, may I start by apologizing on behalf of our minister, who also had this issue of the new variant programs, and he's actually very much heavily engaged on, and hence he actually delegated me to continue this task. On the question number 202 asked by Honorable Gillian on the issues related to the healthcare system readiness, our response is the National Department of Health has engaged with provincial health departments and other stakeholders in order to understand challenges experienced by the health system during the previous waves, and to ensure that lessons have been learned and that plans are in place to prevent and respond to the anticipated 4th wave. The process has focused on a number of key areas, for example, the following: governance and leadership. How strong are we on epidemiology and data harmonization? Number 3, clinical governance and care pathways. 4, health facilities readiness, contact tracing and screening, risk communication and community engagements, continuity of essential services, and the last one, mobilization and optimal use of resources. The health facilities readiness workstream plays a key role in preparing health facilities to be ready for the 4th wave. Ensuring adequate oxygen supplies, respiratory devices, and consumables at health facilities is a critical component of providing care to the increased number of patients who require hospitalization during the waves. An oxygen task team meets every week to ensure readiness of health facilities and is working with oxygen services providers to ensure that continuity plans are in place. The department held webinars, which are actually among learning platforms in the area of clinical governance. These lessons learned from these webinars will assist, and they continue to assist in strengthening case management in hospitals during the fourth wave and beyond. In order to address increased movement and social gatherings associated with upcoming event periods, the risk communication and communication engagement workstream is busy making a plan how to navigate through the festive season and safer holidays campaigns. Each province is in the process of finalizing a provincial resurgency plan. These plans will be consolidated into a national resurgency plan. In addition, senior technical managers have been allocated to work with provinces that experience challenges during the second and the third wave. Thank you very much, Chairperson.
Thanks very much, Honorable Minister. Honorable members, the first follow-up question is Honorable and beyond on usual. Honorable Beyond.
Thank you, House Chair. Thank you, Honorable Deputy Minister, for the response to my question. It seems like Gauteng is going to be the epicenter of the fourth wave, as it was recently in the third wave. Are there any specific measures in place to counter the increasing rate of infections in Gauteng and also stop the possible spreading of the infections to other provinces? Thank you, Deputy Minister.
Thank you, Honorable Chair, and thank you to Honorable Gillian for the follow-up question. As like in the first report, first answer given, with the end of the third wave, nothing was dismantled in terms of our readiness. The human resource plans, the equipment, we did not dismantle the infrastructure. We have also kept the experience and the skills that have been there because we were very much aware through the Ministerial Advisory Committee to the Minister. They kept on updating us that there will be a third wave, there will be a fourth wave, possibly another wave. Therefore, don't dismantle whatever that we have put in place. Yes, just in specific with Gauteng, there are 4,407 beds that within the public hospitals that have been reserved specifically for COVID. This is an experience that they used. They had kept these beds even for the third wave, but they managed to only use about 2,300. So they did not even touch all 4,000. But for this, we have kept 4,407 beds all over the province. We also have a risk adjusted and demand informal strategy that we have kept in place. We do have in that province meetings that they have with AFROX that continue to make sure that post that wave, they started continuing having these meetings where they want to monitor the bulk of oxygen tanks and oxygen cylinders, which is very strategic in the management of COVID. We continue to find in all provinces monitoring of the PPE, water supply, electricity and backup of support, medical waste disposable, and 6,309 personnel that were employed specifically just for COVID in Gauteng. We have kept them, though they still remain on the contract. There's a collaboration and this continuous specialization, specialists giving us direction in public health and epidemiology. Honorable Chair, you would know that even though we have challenges in the country, but we have major hospitals in our country not experiencing the electric problems despite here and there load shedding, because we have in place generators that have got enough diesel that is being monitored. So the same will actually apply in this case. Thank you very much, Honorable Chair.
Thanks very much, Deputy Minister. The follow-up question 2 is Honorable Mr. M.R. Baha.
Thank you, House Chairperson, and good morning, DM. We note that numbers are currently rising on a daily basis. South Africans are preparing to go on Christmas holidays across the country during this festive season. Obviously, with the rising numbers of COVID-19, that poses a danger across the country, which means the fourth wave is upon us. Many South Africans have not taken the vaccine at all. Now, my question is, what is the detailed plan of the department in ensuring that we don't see unnecessary spike in COVID-19 numbers in the country? Mainly, what is the plan of ensuring that we don't see a massive growth in terms of COVID numbers as we approach the festive season? Thank you, Chairperson.
Thank you, Honorable Member, Honorable Deputy Minister.
Thank you, Honorable Chair, and thanks for the question from Honorable Bach. Maybe just to start by saying we have up to 25 million vaccine doses that have been used in our country as of 2 days ago. I'm not aware of yesterday's figures, I did not check them. That translates to 41% of the population in the country, adult population that has been vaccinated. Yes, you are correct. We would have wanted to have more than 41%, but we are actually wanting to increase these numbers to more than that. You are correct. The scientists are guiding us and telling us that maybe these rising numbers are as a result of this new variant Omicron. And you are correct that we are approaching Christmas. So what is the plan in the country with regards to this process? The first bite will be to still encourage our South Africans to go and vaccinate, because we are actually saying, and this is the advice we get from scientists, if you are vaccinated with or without a new variant coming in, because this variant is like a sister, a brother, a twin sister to whatever you already have, that you have formed a defense against if you are vaccinated. Therefore, it is actually unlikely that this new variant or any variant will have a devastating effect to individuals who are vaccinated. We also know this because people who are vaccinated, even if they get a reinfection or admitted, don't do as badly as people who are unvaccinated. So we urge South Africans to continue to vaccinate. But we are actually saying, as the president announced 2 days ago, maybe someday you are going to decide whether an individual right of Dr. Shlomo refusing to vaccinate is bigger or better than a collective right of the people that he's worshiping within the church, the people that he goes with to the malls, and the people that he goes to the stadium with, to say maybe we are going to consider, let's discuss as South Africans, whether we should not say, good enough is your individual right to refuse to vaccinate, but please do stay at home and not meet with us when we are in the taxi, when we are in the stadium, and when we are in the church, because we would want to be protected. We don't guarantee that South Africans are not going to continue getting a COVID-19 infection. But what the vaccines do is to guarantee that that vaccine given to you will not make that to be a very bad dent on your body. You'll be protected to some extent that you won't go to ICU, you won't have long, prolonged hospitalization, and obviously you'll escape death. That is what we are really aiming to push as a country, as government. Thank you very much.
Thanks very much, Deputy Minister. Follow-up question number 3. It's Honorable T. Aplain. Is it he on visual? Okay, Honorable Aplain.
Thanks, Chair. Thanks, Chair.
Okay, continue. Honorable Chaplain. Maybe he's struggling.
He muted himself. He just muted himself.
Unmute, Honorable Member. You have unmuted yourself, please.
My apologies, Chair. Thank you.
Okay, continue. Kuba sana.
Chair,
Eh, yes, honorable member.
may I take Honorable Apleni's question? He seems to be struggling. It's Mukause.
You do have.
Yes, may I
Okay,
continue, Chair?
it's okay, honorable member. You can.
Thank you, Chairperson. Chairperson, hospitals such as Butterworth, Tatafueti, Madoleni, Victoria, which are in the rural ends of Eastern Cape, are and have always been overwhelmed by a shortage of doctors, nursing staff, equipment, and bed capacity, even before the pandemic. Have hospitals managers in rural Eastern Cape made assessment and projections and put plans in place to ensure sufficient staff and hospital beds capacity for the next wave? If so, can the minister please provide details in this regard? Thank you, House Chair.
Thank you, honorable member, honorable minister.
Thank you very much, Honorable Chair, and thanks for the question of Honorable Apleni given by Honorable Mukause. Like in my initial response, we are collating all provincial plans readiness for the resurgence. And that is something that we are collating this week. But they had been given a checklist of things that should be there, that should not be dismantled. The HR strengthening, we were with the MEC of Eastern Cape in Durban on SANAC processes, and she was actually raising the challenges that we need to top up because they have kept some staff members who are on contract, who were brought in because of the COVID. And therefore, we do understand and appreciate that some of our provinces are struggling, especially the rural one, but what was there in place is actually not being dismantled, the challenge that we do have. Our solace that we do have is what we are continuously getting as a guide from the scientists that if we are vaccinating, this wave, fourth wave, is probably not going to be as heavy as the first 2-3 waves. Therefore, we will continue to monitor from our center, but we are not running away from that. The needs out there of our hospitals, of our facilities, may be more than what we are able to support and supply, but we'll continue to monitor that and support them when necessary.
Thanks, Deputy Minister. The next follow-up question is Honorable Mr. M.A.P. DeBrain.
Thank you, House Chair. Honourable Minister, according to a report by the University of Oxford, breakthrough infections of the new variant have been reported in South Africa among people who have received the vaccines. So in light of this report, would you and your department agree that the vaccinated are more susceptible for the new variant? And if so, what is the way forward to contain the new variant and the possible fourth wave? And if not, what is the department's interpretation of this report? Thank you.
Thanks, Honorable Member. Deputy Minister.
Thank you, Honorable Chair and the Honorable DeBrain. I have not been able to see that report, but I'll go along with the advice of the scientists that actually gave us support yesterday. And they actually explained and they showed that, yes, this new variant has got a lot of mutations that it comes in. It's a defense mechanism that is done by any human, by any organism, be it a virus, a bacteria, or us, against a defense, creating a new defense because it now knows that we are dealing with it in this way. So there are some parts of that virus that remain and actually are still susceptible to the vaccine that we give. Yes, they also are giving us a story that there are certain parts of that virus that might show that virus escaping the immunity that we do have. And that is something that they are advising us. But overall, they are saying if our antibodies that we have against this virus, either due to vaccination or due to having been previously infected, if the antibodies do fail, there is something in our bodies called T cells, which is a very long-lasting immunity against it. That will be another add-on to support. Going forward, we are still dealing with the COVID-19 virus. It changes colors, shape, and all that, what we call mutations. The rationale still stands. Let us vaccinate, because part of that virus will be susceptible to the vaccine. And therefore, whatever you get will still be COVID-19 infection. It will not be worse as if you are not vaccinated. Therefore, we will be advised, and the scientists are saying in the 2-3 weeks to come, they will be able to see and notice how virulent, how strong is this new variant against our bodies. Nevertheless, let us vaccinate, because part of that new virus, this new variant, is still susceptible to the vaccine. Thank you very much, Chairperson.
Thanks, Honorable Minister. Siyakuba, siyaku question 197 that have been asked by Honorable Baha, Honorable Deputy Minister. Question number 197.
Okay, thank you very much, Chair. On the question that has been asked by Honorable Baha regarding the incident in Cuba in our universities, our response is the incident happened on the 7th of November, 2021 at Santa Clara University. We were informed by our health attaché in that country, Dr. Sanele Madela, the students were actually beaten by the police on campus during the birthday celebration party, which was supposed to have started at 1900 hours, but ended up starting at 2100 hours and went on and on until very hours in the morning. It is not known as yet who called the police. However, the students have admitted that the police indicated that they should switch off or lower down their music, as it was too loud in those early hours of the morning. And the students are also having their residence within the hospital premises where patients are kept and were there. On B, we have been informed that the school management, the university management, have notified the provincial leadership of Villa Clara, which is a university, and a commission has been established to investigate the incident. We will await the outcome of the investigation, and I just took it upon myself yesterday to phone the health attaché, Dr. Madela, and they will have a meeting this week where they're hopefully going to get the update report with regards to the whole incident being investigated. Thank you very much, Chairperson.
Thank you, Deputy Minister. The follow-up question. It's Honorable Baha.
Thank you, House Chairperson, and thank you, DM, for the response. Whilst the DA does not support the Cuban program, the students remain South African citizens. What assurance will the government obtain from the Cuban government as to the safety and security of South African students in Cuba? Thank you, House Chair.
Thank you, Honorable Member, Honorable Minister.
Thank you, Honorable Chair, and thank you to Honorable Baha. Your opening comments, Honorable Baha, do indicate that you do actually acknowledge that there are South Africans who are residing in Delft, Mitchells Plain, Gugulethu Nyanga, who could actually be beneficiaries of this program, but are not because of a decision of the DA in the Western Cape. We hope that one day that problem might be looked into. We are actually having this arrangement that the sovereignty of any country might actually be very different. So we are actually saying if our students go into Cuba and continue to remain there and understand that they are there just to get a degree, they are visiting to get a degree and go home. They may not be able to change laws and everything else in that country. If that country says you shall not have a party beyond 2 o'clock, and you probably wouldn't be able to come back and say, no, but we do have that in South Africa. So certain laws, you have to work within certain laws. I'm not wanting to preempt the report, but the police being called in there were as a result of some citizens of probably that country noticing something that was an anomaly as far as they are concerned. We want to actually plead with our students to continue staying within the residences, but if they do go, continue to also go out in groups so that they could also be protected and protect themselves even against any. We have had some of our students there, of course, not just in Cuba, here and there, having to fight with the Cubans when they go to some places of enjoyment, shebeens, and also parties. So we would want them to continue to remember that it's another country that got its own laws, and therefore the governance of the country will be respected by all of us. It can't be that, no, but South Africa, we have parties right through the whole night. And if that country says you shall not have it beyond this time, if you are within the residence of the university and you are next to the hospital, we will want that to be respected. Thank you very much, Honorable Chair.
Thank you, Deputy Minister. The next follow-up question, number 2, is Honorable Ms. A.D. Malika.
Thank you, House Chair. And thank you, Honorable Deputy Minister. Deputy Minister, were there any student who suffered serious injuries because of the beating and has been communicated with the parents of the affected students? Thank you.
Honorable Minister.
Thank you, Honorable Chair, Honorable Maleka, for the question. Yes, there were students who were injured, but not seriously so. All of them from that party who were involved in that were taken to the hospital and they were all checked. This is now according to the report, and Dr. Mandela happens to be a medical doctor himself, also trained in Cuba. This is the report I get from the health attaché. They were actually taken in there, examined, and they found to have had minor injuries, scratches here and there, police pushing them against the wall or this and that. And then also, the intervention was there to say after they have been examined, there was an intervention, not to have them arrested, because what charge were you going to lay at them at that time? The university came in and therefore were since taken to their residences. And I'm glad to report that they continued, because this was Saturday, on Monday, all of them went to school and they continues to be at school. Yes, the report to parents did not come in directly because we don't have a report here that it was Sylvia Maleka or Sbongsen Lomo who was involved in there. But however, our online psychosocial support done by provinces of social workers and psychologists has since been done where our students, well, they said, look, it's too far to come back home. You are not sending us enough of those psychologists and social workers that we need. Can you create, and it was created, psychosocial online support where students are able to ventilate, speak to our social workers. That is done and coordinated by provinces. That has since been established, but once the full report has come through, all what we are happy is that there was no student who actually suffered severe injuries, and there was no student who was ever admitted in hospital, and there were no arrests thereafter. Thank you very much, Honorable Chair.
Thank you, Deputy Minister. The follow-up question number 3 is going to be asked by Honorable Mr. K. Mutsamai.
Thank you, Chairperson. Minister, what is the outcome, the investigation of the incident as was conducted by the Department of Health? What protection has been issued to the student in Cuba for their safety and knowing that this will never happen again to them? I thank you, Chair.
Thank you, Honorable Member. Honorable Minister.
Yes. Thank you very much, Honorable Chair. Honorable Mutsamai, like I indicated, we have not since been furnished with the report of the full investigation. The report will then, once completed, be given to Department of International Relations and the Cooperation, DERCO, and then they will share with us. The Dr. Madela, who's our health attaché, is indicating that this week they will have a follow-up meeting. Hopefully they will get that report. Standing where I am, it would be difficult to say this will never happen again because it takes two to have such an incident. It takes me respecting the sovereignty of this country, and it takes that country's police to restrain themselves into that. Until we get to know exactly what was the cause, it will be difficult to say never happen again. So it may actually be how well do we orientate and assist, support our students when they travel to Cuba to say, by the way, you are going to study, by the way, you'll be in a foreign country, that country has got its own laws. We would not be able to actually change those laws. We just have to continue to respecting them within the confines of your study. You're just there to study, and please, as soon as you finish, you will come back home. So we would hope that that report is going to assist us to really be able to assist that something like this should be avoided happening in future. Thank you very much, Honorable Chair.
Thank you, Deputy Minister. The follow-up question number 4 is going to be asked by Honorable Mr. X Ngwezi.
Hlonishwa Sihlalo, ngiyathokoza ukuthola ithuba. Ngibingelele ukukhabela nabahlonishwa bonke. Dinangwe, many South African students have been forced to study abroad, given the lack of spaces in our universities to accommodate health professionals, and are left open to abuse by other countries who do not offer the same levels of democratic freedoms. With the impending NHI scheme, what measures have been put in place to accommodate all students of medical sciences in South Africa and in order to ensure their safety? Ngoba kuyasikhathaza njengeqembu lenkatha ukubona izinto ezenzeka kubafundi bethu emazweni angaphandle, nakuba siqonda ukuthi ngeke sikwazi ukushintsha imithetho yakhona, kodwa indlela ababebaphathe ngayo abantu bakithi eNingizimu Afrika kusikhathaza kakhulu njengeqembu lenkatha. Khabela.
Siyabonga, Honorable Minister.
Siyabonga kusihlalo, sibonge kumfowethu Ngwezi. Asiqale ngokuthi ukuyofundisa abantwana eCuba kwangeve ngoba ngempela ukuthi nje kufuna kuqedwe imali. Kwaba isimo esabangwa ukuthi ama-university la ezweni lakithi ayengavulile, ayengazandisile izibalo zabantwana ebathathayo ekutheni bafundele udokotela nazo zonke ezinye imikhakha, nanokube uyasho mfowethu uqinisile siyayidinga NHI izobadinga abantu abaningi. Ke manje sebeqalile bayazandisa indawo zokuthi sithatha abantwana abaningi. Kodwa kubalekile phela nawe mfowethu nawe uhleli khona uyayazi ukuthi ngeke ngifike kaNgwezi bese ngiyiphatha ngokuthi ngizoyiphatha ngemithetho yakwaDlomo. Kubalekile bafike bahloniphe abantwana bethu. Nami ngohloniphe ekhaya noma ngabe ngiphi inyama iphuma ngeyithebe kwaNgwezi. Ngithi mesiqeda ukudla inyama sithi Ngwezi, sibonga ukuthi kwakho lana. Ngakho ke akuyona into yokuthi uma sivuleleke kangaka sine democracy country wonke amazwe ahambisa ngenqubo yethu. Kodwa into ejabulisayo ke ukuthi nabo laba bantwana sengathi ngaze kuhambe sibone ukuthi ngeke bazofunda ngala ekhaya kwande umthamo wama-university. Lokho kuyalungiswa, kodwa phela lokho kuyazeka mfethu ukuthi inhlonipho iyenzeka ekhaya, kakhulukazi imithetho nje yakulelo khaya okulona ufike uhloniphe. Ofika phela mawusugoduka ekhaya, we need to continue to respect the laws of the country where you find yourself in, because you are there just to visit, you are there to study. You will probably not be able to change, but the country is already in a mode where there are universities, medical schools expanding the number of students that they are taking into there while we are. So maybe in the next few years, we'll be sending less and less students to Cuba and elsewhere in the world, because there will have been enough support and base for them to train within our own universities, provided they continue to expand. But we jealously want to guard against the program of Cuba, because that program in Cuba is superior to any other program in the world. That is why not only in South Africa, even in the Western Cape, DA supported. We do have Cuban trained doctors who are here to support our COVID, because they are in Italy, they are in Spain, because they are the only public health specialists in the world who are able to manage pandemics. And therefore that training, that trait of training students according to how Cuba is doing public health approach is something that we want to really support. And we probably want to see if we cannot bring that type of training into our country. Thank you very much, Honorable Chair.
Thank you, Deputy Minister Siakoba. Now we're going to question 203 that have been asked by Honorable MSN Ndongeni, ANC.
Honorable Chair and honorable members, Honorable Ndongeni asked a question with regards to our national strategic plan on HIV, TB, and STI, sexually transmitted infections. And our response on this question is this: there are three parts, quite a lengthy one. And Chair, when I'm done, when I'm not able to finish, then you will probably cut me. I'll paraphrase about 3 pages. That Honorable Ndongeni is asking whether there are any improvement plans in the proportion of patients that are successfully treated. We want to say yes, there are, because the treatment success rate has increased from 73.8% in 2010 to 78.8% in 2019. The proportion of multi-drug resistant TB patients who were successfully treated has increased from 40% in 2010 to 63% in 2019. This marked improvement has been due to the introduction of a shorter treatment regimen with all oral medications for a period of 9 months in June 2018. The treatment success rate for patients with extensive drug-resistant tuberculosis has increased from 9% to 60% 2010 to 2019. This has mainly been due to the introduction of new and more efficient medicines for the treatment of XDR-TB. The TB death rate remains high, however, at about 42 per 100,000 amongst HIV-negative patients and 61 per 100,000 amongst people living with HIV. Much has there been a downward trend in mortality, we are far from reaching our national strategic plan targets. Therefore, a lot still needs to be done to reduce these unnecessary deaths from a preventable and curable disease. In improving the TB notification in 2017, a strategy to find people with undiagnosed TB in communities was developed and implemented in 2018. This was informed by the gaps identified in the TB care cascade. This resulted in an increase in the number of TB notifications in 2018 and 2019, but this trend was disrupted by the national lockdown in 2020 and 21. Maybe I could just end by saying on this one, we are actually doing catch-up plans in the department. Was the disruptions that came in really have impacted negatively on some of our programs. The introduction of the new rapid urine test for TB make it more accessible to communities rather than expecting patients to contacts of people diagnosed with TB. In 2020, a new regimen for TB that is taking preventative TB that is taken for 3 months was introduced in the 5 districts as a pilot, and it will be scaled up in 2022. There was a request to provide the number of provinces that are actually having the worst TB cases, and the following are KwaZulu-Natal, Eastern Cape, Western Cape, Gauteng. They contribute about 70% of the total TB burden in the country. The 10 top districts in the country with the highest number of TB patients are eThekwini, Cape Town, Johannesburg, Nelson Mandela Metro, Ekurhuleni, OR Tambo District, Buffalo City, Cape.
As you conclude.
As I conclude, we just have to notice that these are districts that are mainly in the metros. There's actually a lot of TBs in places where there's high mobility of people, and that we need to actually be very much mindful of that. Thank you very much, Honorable Chair.
Thank you, Deputy Minister. Follow-up question number 1. Honorable MS Ndongeni, ANC.
Thank you, House Chairperson. Thank you, Deputy Minister, for your comprehensive report to my question. The TB Quality Improvement Project is currently implemented in 27 of the 52 districts. Is there any plan to further expand the project to other districts? And when is the department planning to do so? Thank you, Chairperson.
Thanks, Honorable Member, Honorable Minister.
Thank you, Honorable Chair and Honorable Ndongeni. As we are coming to a close, indicating on the main question, how many and which districts are really giving us a high burden of TB in the country. Those are the ones, those are among the 27 that we started with, making sure that they are put into the priority for TB quality improvement. You are right, is there a plan? Yes, we would want to expand, but without forgetting that those that are the 27 that we have mentioned, we continue with them. So there's, of course, with these catch-up plans that we want to put in place, also supporting our TB program, the remaining 25 districts, we are planning that next year, 2022, 13 will be added on in terms of this TB quality improvement, and the outer year, 2023, we do the balance, which is 12, so that all of them, but without forgetting that why we started with this 27 is because this is the high TB burden districts. Once that is smooth sailing, we bring the rest of the other districts in the country so that we don't lose out and find out that we are concentrating on those that are high burdened and forgetting the rest of the country. So they will be brought in also. 2022, we have 13, and 2023, another 12. Thank you very much, Honorable Chair.
Thank you, Honorable Minister. The next follow-up question number 2 is going to ask by Honorable Mr. T. Aplain, EFF.
Chairperson,
Yes, ma'am.
Ms. Mukause, can I take the question on behalf of Honorable Plenary?
Okay, you can continue.
Thank you, House Chairperson. Deputy Minister, there remains a number of gaps in our healthcare system regarding tuberculosis services in the implementation, as patients are not receiving on time TB results or starting treatment on time and not finishing the treatment. They are absconding in huge numbers, and there are no adequate contact tracing and screening testing services in place, which leads to ongoing community transmission, which is the main driver of the increased incidence in the Eastern Cape. In addition, one also finds that in a remote areas such as those found in the Eastern Cape, health services are not easily accessible, and the health promotion programs are not visible. You will appreciate, Honorable Minister, that the community-based caregivers are the one in the front line of testing, and they are not permanently employed. What measures are you putting in place for such services to be accessible, and when are you absorbing these community health care workers to have more benefits and be covered by the health department? Thank you.
Thank you, Honorable Member, Honorable Deputy Minister.
Part of the questions that are coming in is a new question from Honorable House, but because issues of health are always important to give information on, we will if we can able to. I'm not sure what Honorable Mukause's period is referring to, but if it is just a few months back and that, yes, we do admit as a department that the COVID-19 has disrupted our services significantly. Where we might have been doing well, we have not done very well. However, countrywide, we have a guide, including in the Eastern Cape, a guide of 90-90-90 for TB, as also we have for HIV, to say 90% of South Africans who actually are found to be have TB must actually be given that diagnosis, but it depends on, are they coming forward? Are we able to give results? Usually now there's a particular machine called the Gene Expert. That Gene Expert is able to assist us in terms of being able to produce. Long time ago, we will have TB results after 2 weeks. Now we have TB results within 2 hours. So you could take a sputum specimen from a patient, ask them to wait a bit in the hospital, and by this afternoon, the results will be out and you will be able to start them on treatment. Now, we are saying once patients have been started on treatment, 90% of them should actually be able to, those that are 90% who have been diagnosed should be put on treatment. We may be finding delays here and there, and the gaps may be how accessible, how easy it is, because 6 months treatment is a long period. Some of our people are not able to come as often as we wish because of challenges of transport and the poverty. And then again, 90% of those that are on treatment should actually be completely cured of TB. Again, it takes a person taking a tablet every day for 6 months. Sometimes there's been challenges in defaulters, not necessarily because we do not have medication, but because the person just didn't have money to come to the facility to collect medication, or there is nobody to supervise the taking of medication. So the 90-90-90 different strategy in different provinces is at a different level of achievement because of multiple factors that we continue to work on and address. The issue of community healthcare workers is something that is on the bargaining chamber, and their benefits and their processes of employment them to be at a better level is being discussed, and I do not have details now how those discussions are going on, but it's something that we are actually aware it is a process that is to be finalized at some day. Thank you very much, Honorable Chair.
Thank you, Deputy Minister. Follow-up question number 3, asked by Honorable MSH S. Boshoff, DA.
Thank you very much, House Chair. Good morning to you, Deputy Minister. I heard you say that the increase in containment is very good and you gave percentages, and yet we see numbers of people with TB and HIV/AIDS rising. This is adding to the pressure created by COVID-19. An estimated 301,000 patients became ill with TB in South Africa in 2018. This, according to the country's first ever National TB Prevalence Survey. However, some people suffer undetected. Minister, there's been an outcry about the shortage of medication. What I would like to know from you is whether this is still the case and what is the department doing to ensure that these challenges are curbed. Thank you, House Chair.
Thank you, Honorable Member, Honorable Minister.
Thank you very much, Honorable Chair and Honorable Boshoff. Even at the time I was leading in a particular province, when it comes to the shortage of medicines, this is what I used to say, that the onus is upon that clinic, that hospital, that area, because we might be poor as a country, but we are not that poor that we cannot provide the basic medications for TB, medication for HIV, when we know that our people, big numbers of them do have. There is a system in the department written stock visibility monitoring. I also have it on my iPad sitting where I am, where I could screen and check which facility in Limpopo is running short of medication, which facility in Eastern Cape is running short of this type of a tablet and this and that. And if I do have time, I can pick up a phone and check with that nurse, with that healthcare leader in that particular facility. Why are you not ordering the medication that is running out? Was you now know that this week you will not complete with that medication. So that system is allowing and giving all our health managers in all facilities to be able to monitor so that they can actually provide on-time medication to their facilities by ordering. Whether now there's a broken vehicle or a car without a diesel, there's another matter. But all healthcare managers in our facilities in the country have a way of monitoring by just press of a button, medication that is running short and will need to be topped up in their various facilities. So that will actually was done to curb patients not getting their medication on time. Thank you very much, Honorable Chair.
Thank you, Deputy Minister. The next question is follow-up. Number 4 is going to be asked by Honorable Mr. M.A.P. DeBrain, FF+.
Thank you, Honorable House Chair. Honorable Minister, in light of the fact that TB has been a major cause of death in South Africa over the past decades, and according to stats, on an average of 440,000 people develop the disease yearly, why is it that 25 million people could have been vaccinated in a year's time against COVID, but the same urgency to treat TB over decades could not have been achieved? Thank you.
Thanks, Honorable Member. Honorable Deputy Minister.
Yeah, Honorable Chair, if I may ask Honorable DeBrain to talk slowly. I did not follow very well. I had TB in the past decade. I did not catch up the question well. Thanks, sorry.
Okay, Minister, Honorable DeBrain, can you please repeat?
I apologize. Minister, what I was asking is, in light of the fact that TB has been a major cause of death in South Africa over the past decades, and that according to stats, an average of 440,000 people develop the disease yearly, why is it that 25 million people could have been vaccinated in a year's time against COVID, but the same urgency to treat TB over decades could not have been achieved? Thank you.
Minister.
That Honorable DeBrain is like suggesting that Honorable DeBrain, we are not putting as much of an effort on TB as we are putting on the COVID-19. Is that what the question is all about?
Honorable DeBrain.
Minister, yes, in a nutshell, because as I said, all of a sudden it was possible to have 25 million people vaccinated in a year's time against COVID. But with TB that has been with us now for decades and decades, we are still struggling to get treatments to our people over the last 20 to 30 years. So my question is, how does that work? How is it possible that all of a sudden with a new pandemic, and we can vaccinate 25 million people a year, but we couldn't have accomplished to treat people over decades for TB?
Okay. Yeah, I would imagine it is related to, there is also, let me answer it with this, there is a structure called SANAC, South African National AIDS Council. The issue of HIV in the country was elevated to the level of presidency. And therefore, because you are correct, the issue of TB and all these other illnesses is not a sole responsibility of health. We can give our people as much medication as possible for as long as they are still living in a small shack, unventilated, poor sanitation. That medication is not good enough. So elevating some programs to a level of presidency like we do have in SANAC, like we also do have in this campaign on COVID, makes every other department to put their wheel on the shoulder on the wheel in terms of bringing what is due, because we can actually say the person who's taking TB treatment is not going to be well cured if they still continue living in a small shack. You need to get a sister department to be able to assist you with expanding that shack into a decent housing so that there's improving ventilation. Right now, that part we are now going to learn going forward to say, if any community is not having good water, you are not likely to get that community out of diarrheal diseases. So you need to, so it may be a wake-up call to all of us in the world that diseases, if not well looked after, can actually cause a pandemic and cause a depression of economy. Maybe we need to pay much more of the focus in that, because they have such an impact that can devastate economies in the world if people are not well looked after health-wise. not only do they just get absent from work, but they can spread the illness to other people and cause a devastation in the economy. I could probably be able to provide that if maybe we can elevate all disease burden to that level, maybe all of us will understand what an impact it will cause if we do not pay a good service to health service provision. Thank you, Chairperson.
Thank you, Deputy Minister. Honorable members, we are continuing to our question that have been asked by Honorable Mr. X Mwezi, IFP. The question, Deputy Minister, is question number 201.
Okay. Honorable Chair, the question asked by Honorable Ngwezi is with regards to the statistics of healthcare workers in the country who have been vaccinated. The total number of healthcare workers who are working in the public sector is 395,969. Of those, 289 are vaccinated. And the breakdown is just over 45,000 Eastern Cape, over 18,000 in the Free State, over 57,000 in Gauteng, over 65,000 in KwaZulu-Natal, just over 34,000 in Limpopo, just over 20,000 in Mpumalanga, just over 22,000 in Northwest, just over 7,000 in Northern Cape, and just over 28,000 in the Western Cape. There's another 1,017 of those who are working in our offices in the National Department. Now, that was what was asked. Therefore, the second part is that during the Sisonke, a total of 496,848 individuals were vaccinated with a 1 dose of J&J. They are now eligible to receive the Sisonke booster dose of the vaccine, and they have already started getting that. I do not have the figures as yet of how many of those that we are now taking for the second booster have since been vaccinated. It started about 3 weeks ago to get them to be given. But it would be important, maybe there will be a reason why we are doing that. Maybe let me stop there for now as to we are doing it now. Thank you very much, Chair, and thanks to the Honorable Member.
Thanks, Deputy Minister. Follow-up question number 1 is going to be asked by Honorable Mr. X Ngwezi. Honorable Ngwezi, IFP. Honorable Ngwezi. Honorable Ngwezi, you are on the visual.
Thank you very much, Honorable Chairperson. Honorable Minister and colleagues, we have received reports from certain hospitals where some healthcare workers are reluctant or hesitant to receive these booster shots. I would like to know what arrangements have been made to provide education regarding the vaccine booster to healthcare workers to encourage them that they participate fully and spread the positivity of taking such boosters. Thank you.
Thanks, Honorable Member. Honorable Deputy Minister.
Yeah. Honorable Chair and Honorable just for the record of this proceeding, I am Deputy Minister. Deputy Minister, please let's maybe remember that part. Yes. Like I did indicate to the first question of Honorable Ngwezi, of the 395,000 of our healthcare workers, 301,000 have been given the first J&J. We do not anticipate that there will be a resistance for them to get a booster. In fact, we are actually motivating and encouraging them to do that. The scientists are saying to us, we do not have enough information that indicates when will this immunity against the variant or against the virus wane from your body. We err on the side of boosting them even before they fall sick. Currently, we have South Africans who are still admitted in hospitals. And those are the South Africans who are being looked after by these healthcare workers. So we rather say the first healthcare workers, our healthcare workers were the first online to receive the vaccine. We then want to start boosting them because we do not want to hear a story 2-3 months down the line that half of our healthcare workers have since lost the immunity against the virus, and only then we start. We are topping up even before it's like if you are driving a car, before you run empty in your car, you just top up. You keep on topping up because no scientist is yet able to guide us. It's a new disease in the world to say, by this time, come 2 years, you would have completely waned off your immunity. So we are topping up. There is already a talk that we are going to be topping up, and it came from the president's speech, those patients who are on renal dialysis, patients that have got autoimmune disease, patients who are immunocompromised. So every other week, South African will be topped up even before they fall sick. So we do not anticipate that there will be a huge resistance from our healthcare workers taking it, that a significant number of them did take the first dose, and the motivation for giving them a top up is just as good as why we gave them the vaccine in the first place. They are the first online. They are always there looking after this. I can avoid to be closer to a COVID-19 patient. They don't have that choice. So rather, let's put them and give them the support that they do need in the event that, by the way, I might as well indicate this. Because I still have a bit of half a minute. I did not understand this until I was told by one healthcare worker to say, when we go forward, we need to support the children of the healthcare workers. There's been a lot of mental illnesses amongst them. These children were saying, Mama, are you sure you are going to go to work today? Yet you told us that the person you were nursing yesterday died. What if you come back with COVID and to all of us? And the mother will still go on and go to work, leaving the children anxious to know whether their mother is coming back with COVID there. So that is another cohort of South Africans, children of the healthcare workers, how much they've been affected by the COVID, seeing their parents going to work, nurse the nation at the expense of them remaining at home, not sure whether the mother is going to come back with COVID or not.
Deputy Minister. The follow-up question number 2, it's Honorable MSA Lituli, but she's not on the platform. Honorable Mokause, can you assist? She's not on the platform.
Chairperson?
Yes.
Yes, Honorable Lituli is not on the platform. May I take the question, Chair?
Yes, you can.
Thank you, Chairperson. Honorable Deputy Minister, the fact that to date, only 48% of the adult population has been vaccinated, and that we have witnessed a gradual decline in vaccine uptake across the country at the time where there really should have been an increase. Which steps have been taken to encourage healthcare workers to participate and take the booster dose, irrespective of the myths around the booster dose, Deputy Minister? Thank you.
Thank you, Honorable Member, Honorable Minister.
We have not started long ago with the booster to the healthcare workers. And we are not worried. In fact, there was a time whether we should we wait a bit to start and let them push these numbers of the population, but then a decision was taken. That's also, while we are actually asking them to vaccinate our population, that also them get the booster. So like I'm repeating, I don't fear that we will not have a significant number of our healthcare workers coming in for their booster. They understand a significant number of them and appreciate that this is something that is absolutely necessary. Having taken the first dose, a significant number of them do see in our discussion, they understand the reason for a booster. They are to be the best to be protected. If we want, in fact, let me just indicate the first wave that was coming into our country, and to a large extent, the second wave, we lost a lot of healthcare workers. But after they have received their vaccinations, we have seen a significant drop of all our healthcare workers in terms of death, including teachers. So there's been an observation in the country, even amongst their colleagues, that there is a merit in actually vaccinating, because I'm nursing a patient who's caught COVID here, but with my colleagues, may they rest in peace. Those who passed on before the vaccine, I am better off, I am vaccinated. We are now saying, let's take it forward. Let's take it even further. Protect you even much more. Get a booster even before your body tells us that it is no more having the immunity and support. So we do not see this is going to be a challenge. They are coming in. We have got an increasing number, 48% out of the 100%. It's a small, it's actually a significant figure, noting that we've just started vaccinating our healthcare professionals 3 weeks ago with a booster. Thank you very much, Honorable Chair.
Thanks, Deputy Minister. Follow-up question number 3. It's going to ask by Honorable MSMN Gillion, ANC.
Thank you, House Chairperson. Thank you, Deputy Minister, for that response. Now, Deputy Minister, a large majority of our elderly population has been vaccinated. And the President announced that at the stage introduction of boosters, commencing with the older population will be recommended. Does the government have any idea when this will be implemented? Thank you, TM.
Minister.
That is where Honorable Gilon is asking for the booster of the other high risk or just general population. I missed that part.
Honorable Gillion. Can you repeat, Honorable?
The question has to TM with our older population.
Okay, thank you very much, Honorable Chair and Honorable Gillian. It will be done in a staggered manner. Firstly, we are saying we are giving boosters now to healthcare workers because they are high risk, they are at the cold front, they are, as we speak today, looking after COVID-19 patients and any other patient in the country. The second group of South Africans who will be put on boosters are those of us who are on renal dialysis, those who are having autoimmune disease, and those who have got a letter indicated by their doctors that they are in a chronic illness that will need to be boosted. Elderly will probably be also on that group, and the patients who have got certain organs removed in their bodies, like patients without spleen, splenectomized patients, that will be the ones that are going to be prioritized. I would imagine thereafter, we will then at a particular time announce that we are beyond that and now we are boosting every South African. Again, the scientists will guide us when to boost. But Honorable Gillian, our first request and the bite is to get every other South African at least getting the first shot. You won't be boosted unless you have been vaccinated is the first part. So while we are actually saying there are South Africans who are ready and are available for a booster, we are actually still encouraging and pleading with South Africans who have not received anything, because the booster really is just a top-up. It's a top-up to someone who already has got some immunity. Our cry is for those who are zero immunity because they have not been vaccinated. Let those come forward and come out much quicker, and we need to deal with that process very soon. Thank you very much, Honorable Chair.
Thank you, Deputy Minister. Follow-up question number 4 is going to be asked by Mr. TJ Protich, DA.
Thank you, Deputy Minister. May I please start first by thanking you for taking the time to be in the House. Many ministers appear on the television, and there's no sense of being in the House and talking to someone on television. So thank you for that. Minister, you have given us a lot of figures relating to how many health workers have been vaccinated. And it is a sizable number, a significant number. And then you have told us that 3 weeks ago, you started with the booster shots. Minister, given the fact that, as you said, they are high-risk employees, and given the fact that we have the new variant and all the uncertainty around the virility of that variant, what commitment can you give today that the booster shots will be administered to all health workers in South Africa over a very short period of time, given the fact that we are also anticipating a fourth wave, perhaps in December, January? Surely this cannot take another few months. It has to happen now. Can you give us a commitment in that regard, Deputy Minister? Thank you so much.
Honourable Member, Deputy Minister.
Thank you very much, Honourable Chair, and thank you very much, Honourable Member, for your kind comments in your initial input. We already are not scratching our heads for the availability of the J&J. It's there in our storerooms. And we are so hopeful because healthcare workers is not people that you still have to go and bus them from very far. They are already within our facilities. The desire of the minister and our hope we are going to is that by end of this year, by end of December, all of our 301,000 healthcare workers should have received their booster. And we are encouraging them. A lot of them are very much aware. So the vaccination sites are all over, sometimes where they work. So for them, it really should not be as difficult as getting my grandmother into a taxi rank and take a whole range of transport to come to a vaccination site. They will be doing it around the areas of their work. It's a workplace commitment. So I am really confident that this date we will probably announce, and we should, by end of this year, that all our healthcare workers who were due for the booster have taken it. It's true, we owe it to them, because without that cadre of workers, there's no way we are going to manage the health system. Challenged as it is, it still needs them to be there. So we want them to be vaccinated, and the vaccines are there, and they are also very accessible by the same healthcare workers because they are working within the same environment. So I'm confident that come end of December, we may get the minister announcing that all our healthcare workers have received their booster shot. Thank you very much.
Thank you, Deputy Minister. Question 198, Honourable Minister, Honourable Members. The member that have asked the question is Honourable MSD C. Christians D.
Honourable Chair, Honourable Christians, as I'm going to reply on this question, I need to prepare members who are going to do follow up that this one is a specific question about Robert Mangaliso Sobukwe Hospital. It's not like a program, a national program in the government. So some of the follow-up questions may be a difficulty to deal with because I will probably need to go back and look and get answers to come in there. But Honourable Christians was asking that given the number of challenges that continue to affect the hospital in the Northern Cape, what is the current surgery backlog at the hospital and how far does it date back? Now, and other questions subsequently. The current surgery backlog at Robert Mangaliso Sobukwe relate to urology, 471 patients waiting to be done, and this 18 months backlog. The neurosurgery is 70 cases waiting. The waiting time is about 2 to 3 months. The general surgery is 492 patients waiting. The waiting is up to October 2021 of those patients waiting till then. Orthopedics, there's about 14 trauma, 385 on arthroplastics, 180 on elective cases, 10 on casualty. This is about 2 to 3 months backlog that they raised. The ENT, ear, nose, and throat, 750 patients that are waiting to be done. A new list was started in February 2021, which ends up with 100 patients now. These ones have since been attended to. Ophthalmology, in the cataract removal, 1,205 patients divided into blind patients, 170, and surgery, and then the other ones partially sighted, 170 patients with on VULA not yet seen at the eye clinic, 865. So that is the number, and the backlog is about 5 months. The result of a water supply, there was also a comment regarding the water supply and contamination in the hospital. The question is, the response is, the result of the water sample taken on the 3rd of March 2021 and reported on the 23rd of April 2021 by the Environmental Health Unit from the Salt Lake municipality indicated that Block A, E, and KLM and administrative blocks water was contaminated. A second water sample was then done on the 3rd of May by the same municipality, accompanied by the environmental health practitioners from this municipality and personnel from the engineering workshop to determine the source of contamination, and came back non-compliant again. Over the years, birds and animals gained access to the water storage tanks area through broken windows, uncovered vents, and pipe system. The water tank in this KLM block was also rusted and damaged. A cleanup campaign was therefore done by the Environmental Health Unit as part of the water project conducted by the Community Service EMS, EHP. The cleaning up campaign involved quite a lot. It was a very extensive one. The last water sampling conducted by the municipality on the 3rd of September 2021 was taken at the following areas: at Block A, at Block B, Block KLM, the main reservoir tank, and the municipal inlet pipe, and was declared to be safe now for human consumption. The last part was regard to the functionality of the laundry service. The response is, the laundry is fully functional at Robert Mangaso Sobuga Hospital, and it is equipped with the 2 boilers, of which one is operational and another one is due for repairs. A monthly service contract for laundry equipment were negotiated to assist with the maintenance of crucial laundry equipment, in addition to the alternative energy sources that are being investigated to reduce the dependency on coal. We have indicated then which laundries will start to be functional after this repairs is something that we are awaiting to get a further response. Thank you very much, Honorable Chair, for that.
Thanks, Deputy Minister. And then next follow-up question number 1, it's Honorable MSTC Christians.
Thank you very much, House Chairperson. Thank you, Deputy Minister, for your response. Deputy Minister, the Robert Mangaliso Sibukwe Hospital in the Northern Cape has been plagued by major dysfunction for a number of years now. There have been reports of patients dying naked on hospital beds without family members being notified, patients using grocery bags as bandages for open wounds, and family members being denied access to their families, even though they are not in COVID wards. Deputy Minister, is it not time that the Minister urgently intervene by temporarily placing the hospital under administration while investigating these serious issues of administrative misconduct? Thank you, House Chairperson.
Thanks, Honorable Member. Honorable Deputy Minister.
Thank you very much, Honorable Chair, Honorable Christians. Let me say, the specific on this one, I would really want to take the word of Honorable Christians that there are challenges that she's picking up, getting reports about Robert Mangaliso Sobuga Hospital. And they would probably say, I would really be happy to take down the information and report back to this House regarding what we find. Because I would not be able to stand there and say, that is not happening, that is happening. So maybe to be finished, let us be fair and say I would have to come back and give proper written responses to this House regarding some of the issues. But I would not be surprised, because the challenges, the burden on our healthcare system in the country is quite huge. And that hospital is the only biggest ever we have in the Northern Cape. And that hospital also depends on how much support it receives from other hospitals in other provinces, because the waiting and this long waiting is to say they would want to do it in-house. Beyond not able to do it, they will have to depend on the hospitals, Pelanomi next door in Free State, hospitals in Gauteng. And if they are also not willing or available to assist, then the backlogs will be there and the impact of the system will then be huge at that hospital. But we will continue to investigate, but knowing and noticing that provinces that are actually at the periphery, Northern Cape, Northwest, are somehow so much dependent on the certain specialty services to the hospital that are at the center, Free State, Gauteng, and all that. It's not only Northern Cape, including Mpumalanga and Limpopo, they are sometimes dependable on these other big hospitals that are not within their own provinces. Thank you very much, Honorable Chair.
Thank you, Deputy Minister. Follow-up number 2 is going to be asked by Honorable Mr. M.A.P.D. De Bruin.
Thank you, House Chair. Honorable Deputy Minister, I think my question has been covered by Honorable Christians regarding putting the hospital under administration. But just on another note, with regard to the dysfunctionality of state hospitals, will you and your department also please commit to investigate the horrible conditions at the Oranje Hospital in Bloemfontein, especially regarding hygiene, laundry services, and infrastructure? Thank you.
Thank you, Honorable Member, Deputy Minister.
Yeah, thank you very much, Honorable De Bruin, and thanks for the question, Honorable Chair. When the Department of Health gets an announcement that it must do a budget cut, we are going to top slice the department on this and that. The officials will sit within the department and decide what then will be cut to accommodate the top slicing that has been announced. To a very great extent, we lose out on the human resource that is filling more vacancies. The second other part that we lose out on is maintenance and improving buildings and facilities. So we then continue to have deteriorating equipment in certain areas, which may not have left out that hospital also. So it is some of these issues, honorable members, that sometimes it's our own thinking as a department, that if we are actually getting a budget cut, what else do we? Obviously, you cannot stop giving patients food in the hospital. You probably will not stop getting laundry services so that you can clean linen for the patient. You therefore err on the side of not starting projects that you were meant to start, amongst others is an improvement of the infrastructure, building a new clinic, improving the equipment within the hospital. So those are some of the challenges that we do face in the light of this. But again, we need to be very watchful as to, is there no money that gets lost unnecessarily through corruption, through unnecessary and irregular expenditure in that, or fruitless expenditure. That is part of what we continue watching, and that is what is always in this radar screen of the minister in all provinces, supported by all MECs in the country. Thank you very much, Honorable Chair.
Thank you, Deputy Minister. Follow-up question number 3 is going to be asked by Honorable M.O. Mokause. Honorable Mokause.
Thank you, House Chairperson. Deputy Minister, we acknowledge the fact that you only want to focus on Robert Sobukwe Hospital, which is in Kimberley. But the fact of the matter is hospitals in the Northern Cape face similar challenges, including clean water supply and many other issues related to hygiene in the entire hospital environment. That includes Tshwaragano Hospital, Kuruman Hospital, Kagiso Healthcare Center, which services a sizable number of rural areas in the Kuruman area. When is the Department of Health in the Northern Cape Province planning to sort out the issue of hygiene in this particular hospital and clean drinkable water that will actually benefit both the healthcare workers and the patients. Thank you, Deputy Minister.
Thanks, Honorable Member. Deputy Minister.
Thank you, Honorable Chair, and thank you, Honorable Mukausi. In my previous responsibility as a chairperson of the Portfolio Committee of Health in the National Assembly, we took a tour of Northern Cape. And some of the issues that you are picking up, we did pick up. Is not challenges that really are self-made, is they are imposed by some of these issues, budget cuts. And therefore, I'm not very familiar. I have not been able to follow a report that was since to follow us after they were able to fix this, that, and the other. It will be a matter of checking, Honorable Mukausi, as to how far have they sorted some of the things that you are raising. I would not be, but I can confirm that some of the challenges that you are raising, again, you'll notice, I know in another province, they sometimes depend on rainwater and just put tanks so that they can harvest rain, because you still depend on the municipality within that building to supply you with water, and you pay the municipality water. So like we have had in the whole country, challenges of municipalities supply water to that household, to that school. We too in hospitals have had that, and therefore until and unless we make our own plans, if we can have our own sort of, like we now have, can say, I can hear that Honorable Mukausi is not complaining about those hospitals maybe having poor generators or no generators. At least we then learn that because there may be load shedding going forward, let us make all major hospitals, at least those who are doing 24 hours, to have their own generators so that they could be continuously supporting the functionality of the hospital. Yes, we have not done that successfully in all hospitals with regards to water, but it's another area of our focus to say, can we actually be able to do, even if it means we are harvesting rainwater. Of course, you do that in provinces like Eastern Cape, KwaZulu-Natal and Mpumalanga, because there's enough rain. Northern Cape, we don't have as much rain there, but you could even there harvest water, clean it in your own tanks in hospitals and support your hospitals in the event that your municipality has not supported you with well. But what we can do, Honorable Member, is to supply this house with the report, as some of my officials are logged in there to listen to what are the outstanding issues that I'm not able to complete, so that we could finish this house with the report of what are the outstanding issues the member is raising with regards to the province of the Northern Cape and the challenges that she's picking up there. Thank you very much, Honorable Chair.
Thank you, Deputy Minister. Follow-up question number 4 is going to be asked by Honorable Mr. M.E. Nchabeleng, ANC. Honorable Nchabeleng.
Thanks, House Chair. My reception is really bad. Thanks, DM. I've had all your answers, and in some way you have answered partly the question that I wanted to ask. But my understanding is that if there is a surgery backlog, it may mean for the person who's waiting for a life-saving surgery, it may mean waiting to die. While understanding the explanations in terms of what are the challenges affecting your hospitals, are there to deal with this backlog, especially in the Northern Cape, where I think it's the case is more severe?
I hope okay. You can continue, Deputy Minister.
Yeah. Yes, thank you very much, Chair, and thanks to Honorable Nchabeleng. I did get the question. Firstly, with regards to the question was Will not the patient therefore wait to die if we keep on having backlogs? And how do we deal with that? Is there no way that can be improved? This is the scenario that will take place. The clinicians, the doctors.
Order, honorable member, the minister is answering your question now.
The doctors, even at Robert Sobukwe Sibonga Hospital, will categorize patients to say, Lomo has just got a lump on the foot. This lump, because there's so much pressure about COVID and this, that, and the other, this lump is not growing too fast. It's probably just to remove it for cosmetic reasons. We may delay this lump and take it away, maybe when things normalize. But this other surgery is so necessary, it's life-saving. Let us therefore put them not to be on the back of the list, but to be on in the main list. If we are unable to do that because of other challenges in our own Robert Sobukwe Hospital, we will then motivate to send this patient to Pelanomi or Chris Hani Baragwanath Hospital. So it is the doctors themselves who would classify, and we call that an elective case. An elective surgery is that one that can be done as and when situation normalizes. Those ones can wait for a month or 2 or 3, but separate them from emergency operations that must be done within Robert Sobukwe Hospital or assisted by another hospital. So what we would find is that a patient may continue limping with a pain because that patient has not been prioritized to have a hip replacement because that was necessary to make this person to function again. So we rather err on the side of delaying that hip replacement, give that patient tablets to continue walking with a little bit of pain and postpone that, but then deal with another emergency. And therefore you call that hip replacement process an elective surgery that will be done as and when things normalizes, but separated from urgent and more cases that must be done as an emergency. So that is how they rationalize these issues in hospitals and in areas where maybe there's much pressure to deal with all cases at one time. How would they do it? They do it using that guide and the protocol. Thank you very much, Chair.
Thank you, Deputy Minister. Siyaqhubeka. Siya manje ku question 204 that has been asked by Honorable Mr. Nsube, ANC. 204, Minister.
Honorable Nsube has asked a question with regards to whether, in the light of the fact that there's a steady drop in the numbers of vaccinations across the country, what are the processes in place, vaccination though? Our response, Honorable Chair, is this. The poor demand for vaccination is currently our biggest factor, limiting the number of people who are vaccinated, thus resulting in a slow progress in achieving the population coverage targets. In an effort to reverse the decline in the number of vaccines administered each day, the department has developed a demand acceleration strategy which aims to ensure that as many people as possible are vaccinated before the arrival of the 4th wave. And now we already have it around us. The Vuma vaccination weekends are an important component of the strategy. The Vuma vaccination weekends include 4 main activities, namely a national call to action led by our President Ramaphosa and including other political leaders, as well as trade union, religious, traditional, and other leaders. 2, events and visits by national, provincial, and local leadership at vaccination sites. 3, ensuring that as many public and private vaccination sites as possible are open and offering vaccinations. The last and the 4th one, recognition of good performance at provincial and district level and of outstanding performance by healthcare and other workers. 2 Vuma vaccination weekends have already been held, and the 3rd one is planned for the 1st weekend of December, meaning this coming weekend. The Vuma vaccination weekends have played an important role in increasing the profile and the visibility of vaccine rollout. During the first Vuma vaccination weekend, which took place from the 1st to the 3rd of October, 337,251 people were vaccinated. And during the second weekend of the 12th to the 14th, 277,086 people were vaccinated. Although relatively modest, the numbers are significantly higher than those routinely achieved over weekends. During the Vuma vaccination weekends, a higher proportion of administered vaccines were first doses, suggested that the weekends were successful in reaching out of the people who had not been able to be reached out outside the weekend. Thank you very much, Honorable Chair.
Thank you, Deputy Minister. And follow-up question number 1 is going to be asked by Honorable Mr. Ayn Sube. Sube.
Thank you very much, Honorable House Chairperson, Honorable Deputy Minister. There has been an outcry from most of South Africans, particularly the young people, with regard to what the President of the Republic has said, that there will be furthermore consultation about mandatory vaccination. So South Africans have actually, particularly young people, are saying that why is it that our state is going for mandatory vaccination when there has been proven that vaccine can't make one be infected? Honorable Deputy Minister, except for the task team set up to undertake broad consultation on making vaccination mandatory for specific activities and locations, what other measures is the government intending to introduce in order to increase the number of vaccination? Thank you very much, Honorable House Chairperson.
Thank you, Honorable Member. Deputy Minister.
Thank you very much, Honorable Chair, Honorable Sube, for your question. The task team that the President is actually talking about, which should be led by the Deputy President in an interministerial platform. The consultation platform will be the add-on to already some of them that have come before that. And it is actually provoked by this vaccine hesitancy. There are certain processes that have taken place before that. There is a program called Return to Play, led by the Deputy President Mabuza, supported by Minister Mthethwa, where they've visited almost 5 stadia. First one was the FNB, Bombela, Moses Mapita, Nelson Mandela Bay, and in Gqeberha, and I can't remember the name of the stadia in Kimberley. But they were there with sports fans and sporting bodies. They were there with artists, and the people are saying, we are starving, we want to perform, we want to be watched while playing, it gives us a booster, we want to open up, let us return to play. And therefore, you then have this message that comes from the Deputy President each time he is in these areas to say, let us do this, because there's enough evidence that if you are vaccinated, you can then sit a bit at distance from someone else. Even in the stadia, we see that in Europe and other countries. Again, yes, the Vuma ones are going to continue, as we are now getting to inform this House that this coming weekend is another Vuma weekend, vaccination weekend. There is also the Ministerial Advisory Committee of the Psychosocial Team, led by Bishop Mpumulwana, who is actually a key amongst the faith-based organizations, to say what more should and can be done by the faith-based leaders, by their members. I wanted to say one of the success stories we see in Limpopo of a bigger numbers of vaccination is because 2 bishops of the Zionist Christian Church openly vaccinated in public, and subsequently a significant number of members of ZCC have since vaccinated. So we therefore see such leaders as being the biggest influencers in the society. What they do, what they say, many of their members do follow. We also are reliant on Amakosi, and Amakosi have actually been meeting with the Deputy President over this weekend again. Among other things, they say that we shall use our traditional council houses as areas, as vaccination sites. Please make use of them. We as traditional leaders will be vaccinated, and they were there led by Nkosikazi Mhlawuli, indicating their willingness to support. So these are all strategies and plans. There's also another social partner who was saying, if you are 60 years and above and you are vaccinating for the first time in the month of November, we shall give you a voucher that will assist you to be able to access food, groceries in ShopRite, you save, and another shop retail. So those are programs that are already in place. This one that the president announced of a task team is an add-on to already strategies that we already had in place of actually talking about this. But you are correct. I must end by saying, it's the younger people who have not really come up in their big numbers. The 60 years and above in our country, 57% of that population is vaccinated. On the 50 years and above, 53% are vaccinated. So we really call upon the young ones to come forward and take up this issue of vaccine, because those are the young ones also would be very interested to visit and be in stadia, be in the entertainment industry and all over in the country. Thank you very much, Honorable Chair.
Thank you, Deputy Minister. Honourable members, the follow-up question is going to be asked by Honourable House, because Honourable is not on the platform. Honourable House. Thank you, House Chairperson. Deputy Minister, it looks like COVID will be with us for a very long time. And fact is, health education on vaccination hasn't been accelerated. The myths around vaccine, it's not thoroughly addressed. Communities receive confusing messages on social media and on their informal discussions. Have you looked at capacitating the community engagement programs, the health promotion programs, which exist within the department in terms of communicating correct messages? And when I speak about community engagement programs, I also include the community healthcare workers, which were thoroughly trained during the HIV and AIDS prevention program. What is the role of private sector in assisting government to communicate proper messages in the communities that they exist in? Thank you, House.
Thank you, Honorable Chair, and thank you, Honorable Makause. You are correct. Your opening comments are correct that COVID-19 is likely to be with us for a long time. And therefore, how much are we doing to capacitate, mobilize, get everybody to understand this process and therefore vaccinate? I would answer that question, Honorable Makause, in this light. Where you are, either as a mother or a grandmother, you know that when you leave a clinic or a hospital after delivering a baby, that baby must get immunized or vaccinated against TB. Why do we do that? Because we have come to accept in South Africa that we cannot be able to wipe away TB. TB is living alongside with us. And therefore, a strategy that we do is to really give every child who is coming in from a very warm, protective environment of the mother into this world and give them a vaccine, which is a BCG. And we give them a road to health chart to come back after 4 months for a vaccine against measles, against polio. Why do we do that? Because measles and polio is all over us. The same principle here is being done. And that information is shared with Amakosi, with traditional healers and with traditional leaders to say, November 2019, none of us in the world had any knowledge of COVID-19. It started a month later. And therefore, all of us were like babies who are experiencing this for the first time. And all of us need to be protected, because why you give the babies that BCG is to say, when they get TB, the TB should not be all over the place. They should not be getting miliary TB. They should not be getting TB meningitis, but they may still get TB limited somehow. So again here, using the same principle, sharing with Amakosi, and Amakosi, Izinduna, traditional healers, and faith-based leaders, they understand this language that once upon a time when we were babies, we were vaccinated. We are now vaccinating all of us, requesting so, because this is a new illness that was never there before 2019 November. So we continue to engage, we continue to request, and we make this message so simple for everybody to read, so that even my grandmother can be motivated to go and vaccinate, because she knew that she took me 50 years ago to be vaccinated when I was small. And this is the information that we are giving. There's a new disease in the world. It's new to our bodies. Our bodies do not have any defense against this disease. So let's get vaccinated so that we can create a defense mechanism against this disease. Thank you very much, Honorable Chair.
Thank you, Honorable Minister. The next question is next follow-up question number 3 is going to be asked by Honorable M.S. Silapskahan, DA. Order, Honorable Member.
Thank you, Honorable House Chair. Honorable Deputy Minister, thank you very much. As you've already said, and we all know now that the uptake of vaccination program is not as remarkable as what we wanted it. And you also mentioned in one of your answers that especially for the youth. Now, my question is, do you have a plan specifically to make vaccines more accessible? Although you said there's a lot of sites, but accessible to the people in poorer areas, given the fact that a lot of our youth are unemployed and they need to spend money on transport to get to the vaccination sites. So is there a plan that the department can do to make it more accessible via transport? So such as something that in the Western Cape that we call the red dot taxi system. Thank you.
Thanks, Honorable Member. Deputy Minister.
Okay, Honorable Chair, Honorable Skakni, thank you for your question. We have enough vaccines and we have taken a decision that let's take vaccines to the people. You are correct, rather than expect people to come to our vaccination sites. So every day we continuously would like to be engaged by people. Where else would they like to see vaccination sites? Sometimes we do have them in most, so that when you walk through a mall, you will find our nurses at the station there. When you are actually getting closer to a traditional house, there will be a vaccination. The clinic next door and the creche where you live, so, and the church where you go. So if you miss it in the mall, but maybe on Sunday you go to the church or you go to the mosque or temple, you will find, and we are very grateful that all these faith-based leaders have opened up. So we are decentralizing. Sometimes we are not there all the time, but we do announce that there will be a pop-up site at this area. And sometimes again, if leaders are going to have gatherings, whether it's a big gathering of whatever event, and you inform the Department of Health on time, we will do that. We'll come to that and just have a pop-up site just for that day, for that event that you have. So anytime you call us, because what are we doing? We actually benefit as a Department of Health to see many South Africans being vaccinated, because then we know our hospitals are going to run empty, which is what we would like to see rather. So anytime you call, indicate, look, we have not decentralized the vaccination sites enough, please come this side, do this. We'll really be listening to those advices because we want to decentralize. Our slogan, that is taking the vaccines to the people, we want to try and live it. If we have not done it enough on it, please advise us what more, which areas we think we have not covered, and we'll really take that up and then come forward and support.
Thanks, Deputy Minister. Honorable members, the last follow-up question, number 4, is going to be asked by Mr. Ngwezi, IFP.
Thank you very much, Honorable Chairperson. And greetings to the Honorable Deputy Minister, as corrected before. The Honorable Minister, the Vuma vaccination program is a good initiative to encourage people to vaccinate whilst helping them to also easily access vaccination centers. I would like to know how feasible this project is in terms of budget allocation to meet the greater reach of this program to a wider range of our citizens. Ngoba siyafisa ukuthi abantu bakithi ngqongqoshe esekela ngqongqoshe bonke bagcine bekwazi ukuthi bajove uma kuwukuthi kodwa iy'nsiza kusebenza ziyasondeleka, kodwa sifisa ukwazi ukuthi ke ngakube inkece yanele yini for lolu hlelo la okusondezwa khona lezi zinsiza kusebenza. Khabela.
Deputy Minister.
Yeah, ake ngiqale kanjena inkece phela ngeke inganeli uma kuwukuthi kufuna kulungisa impilo ngoba if we really plan to save our economy and save our country's resources, we need to make people be safe. We are not safe until all of us are safe. Nobody is safe until all of us are safe. So this Vuma vaccination campaign is driven by national, provincial, and local leaders. It's them who must drive and go to the communities. And we then, yes, have actually been saying our healthcare workers are limited to work, provided you make money available for their overtime, because you are requesting them to work Saturday and Sunday up to about 4 hours, up to about 4 p.m. or later. So that provision, I learned, is there. Otherwise, this is driven by the interministerial committee driven by the Deputy President. Calling for that is by the Deputy President. So therefore, there will be enough resources to make sure we do that. In doing so, we are actually saving and really saving quite a lot that could have gone down on our economic decline. So I may not say there will be enough, but there will be resources available to make sure that these campaigns are continuously driven, because the benefits that come from a successful vaccinated nations are huge. I must end by saying vaccination with that process to say vaccinate, but please let us not forget that the non-pharmaceutical protocols, wearing of the mask, which I'm glad all members are still wearing, the social distancing, washing of hands and sanitizing still remains a key to supporting the mainstay of our process, which is vaccination. Let us continue to do that, because that is how we will actually be able to make sure our country survives and survives this fourth wave and many more other waves that may still come our way. Thank you very much, Honorable Chair. Thanks for all the comments that the members have made, good comments that I will take back to the Minister. And we'll continue to looking forward to your support, because we are the whole nation, we are the people that are supposed to lead and show us where you think there are bottlenecks, there are challenges and mistakes, and we'll be ready to actually go and support. Because at this time, we are given a responsibility to lead in the country in terms of the health system. Thank you very much.
Thanks very much, Deputy Minister, for coming. Honorable members, we are continuing with our speakers, but before I call the speaker, I would like to invite our Deputy Chair, Honorable Mamu. Our Deputy Chair. Okay, Deputy Chair, can you please take over to social development?
Thank you very much, Honorable House Chair, and greetings from Madrid to all of you. And thank you to the Deputy Minister of Health for elaborating extensively on the issues that have been raised. I would now call on my dear sister, the Honorable Minister of Social Development, to respond to the questions. And we are starting with question 205, as asked by the Honorable Malika. Honorable Minister.
Greetings from South Africa, Deputy Chair.
Thank you, Honorable Bakause. Honorable Minister.
Yes, a very good afternoon to you all, and thank you very much, Honorable Deputy Chair. Thank you for the opportunity. I will request that I keep my mask on. I'm sure everyone is aware of the fact that I tested positive And I think I survived this much because of the vaccine. And so the encouragement for vaccine is very important. Chairperson, in reply to question 205 by
Honorable, the advocate, sorry, Honorable Minister, Advocate, can you please assist and the table assist and help with the Minister with the quality of your sound is extremely bad. Can we, I think you can try again.
Yes, Honorable Speaker, I was thanking you for the opportunity, and I was saying that unfortunately I had to keep my mask on because I'm in quarantine and I tested positive. So I'm just hoping that everyone can hear me.
Honorable Minister, unfortunately there is a feedback that is coming from your side. And before we continue, can you log out possibly and log in again so that we just see how it will work for us? Can you leave the meeting and then come back again, please? I'm sorry, honorable members, but we have to try to deal with the issue of the sound quality.
My daughter didn't do the montage.
Advocate, can you follow up? Can we mute the chamber, please?
Chair, can we have the 5 minutes break?
Yes, that could help maybe to allow for the table and ICT to, what is it, technologies to attend to the problem. Are you there, Deputy Chair?
I'm here, Chief Whip.
May we suggest 5 minutes comfort break just for the problem maybe to be attended to?
Yes, please. I think the members can, all of us can take 5 minutes comfort break. Let's say we will be back 10 past 11. My time is 10 past 11, yours will be 10 past 12.
No, that's too many minutes on your time.
It's about 7 minutes, yes.
Sure. Thanks.
Recording stopped.
finish. Are we on break?
Yes, Babungozi, for 5 minutes, we should be back.
By
5
10 past.
minutes, at 10 past.
Yeah, manje amakhosi awabikeliwe phela nama ngisazi ngithina ayangibuza manje ukuthi kwenzekani.
Minister Zulu.
Yes, I'm here now. I'm not sure if this is better.
Yes, that's perfect, ma'am.
That's better, Mr. Minister.
Oh, okay. All right. Okay.
Thank you very much.
We just
Thank you.
We just gave the members a comfort break, Honorable Minister. We
Okay.
will immediately commence at 10 past.
Thank
10
you.
past 12, yes. Okay,
Thank
thank
you,
you
Chair.
very much. Thank you.
Thank you.
Deputy Chair,
Yes, Advocate.
how are you, Deputy Chair?
No, I am fine, thank you. It is a bit of winter, but it's very mild. It's almost like in Uppington. It's just that yesterday was like Cape Town.
Okay.
Because yesterday was like Cape Town with the clouds and so on. So, but Madrid has got a very good weather, though it's a bit cold at night and in the morning. But it's what I am used to in Uppington.
That's great.
Yes, today's the General Council is sitting because we worked so hard in the committees and all of the time was very much compact and hard work. But today the Governing Council is sitting, that's why I said, let me log in here and then 4 o'clock we will join the General Assembly for the closing.
Thank you very much, Deputy Chair. I just sent the latest list of follow-up questions.
Thank you.
Your mail.
I think it is the same one that I've received from Zamadem. And I think we may continue now.
Okay, thank you very much.
Thank you. Thank you. Thank you very much.
Recording in progress.
May we call the House in order? And then we will continue. The minister's sound at least is better now that she came back. So we will give over to the Honorable Minister Lindy Zulu to continue, starting with question 205 as asked by Honorable Maleka.
Thank you very much, Honorable Chairperson and honorable members. Thank you for the opportunity given to us to respond to the questions. Chairperson, let me start by re-emphasizing that we are currently in the 16 days of activism against violence on women and children, and we should upscale our interventions against this scourge, which continues to ravage our country. And in response to the question, Chairperson, yes, I can confirm that the Department of Social Development, that the Gender-Based Violence Command Center operates a national 24/7 days a week. The call center facilitates, which is operated by qualified social workers who are responsible for receiving calls as well as the case referral to local services. The center has an emergency line number, which is 0800 428 428, which is also supported by a please call me facility, which is *120 *7867#, and a Skype line to assist the deaf community. Add help GBV to Skype contacts, and an SMS-based line, SMS help to 31531. All these are a free service to the community, and we encourage members of the community, especially women, to make use of this service. Chairperson, the GBVCC has made significant progress in delivery of services to victims and survivors of GBV. Apart from the 24/7 services it offers, the center also provides immediate response and psychosocial support services to victims and survivors. The center's approach is based on 6 pillars of National Strategic Plan, which I think everybody is aware of, especially Pillar 4, that talks to response, care, support, and healing. I have, honorable members, added to response, care, support, and healing the issue of empowerment of women. In November 2020, I launched a government-owned and government-run bigger facility for the operations of the GBV Command Center, which doubled the number of staff from 15 to 30 as the demand for the work of the center was increased rapidly. And as such, we are now able to accommodate more workforce to respond to the case of GBV across the Republic. Let me at this time also take the opportunity to thank the team at the GBVCC for the great work they are doing. We know that the work they do can never be very easy, and it is very strenuous because they have to receive calls from distressed members of the community, and in particular, women. Lastly, Chair, I also want to indicate the fact that recently I had a visitor, the Minister of Solidarity and Poverty Reduction from Cote d'Ivoire, who I took to the center because the center is very well known now. It has received a few accolades. I took her to the center to show her what we are doing as a country. In addition, Chairperson and members of the public know that we have trained and qualified social workers at the GBVCC. We now receive calls ranging beyond GBVF. Some of the recent incidences we've recorded include, but not limited to, cases of abandoned children, indecent assault, physical violence, rape, verbal abuse, stalking, to mention but a few. And lastly, during the matric examinations, we also received quite a number of calls from grade 12 students who were anxious and required psychosocial support services. We have also received calls from the grade 12 students who were failed, who were suicidal, and we managed to provide support to them in this regard. And Chair, you would then see from these services that we render that there is an urgent need for more social workers in our country to be proactive in dealing with these challenges. And it is for this reason, Chair, that I always say it's not about just the call center. We might be proud of call centers, but women and children belong to homes, and therefore we need to address the issue of gender-based violence, house to house, street to street, community to community, so that we have less calls. A country should be proud of less calls than being proud of more calls to the call center. I thank you.
Thank you very much, Honorable Minister. Thank you really indeed for the response to that question. Honorable Malika, do you have any follow-up? Honorable Malika.
Yes, thank you, Deputy Chair. And thank you, Honorable Minister, for your response to my question. Honorable Minister, has there been an increase in incidents recorded during the lockdown period, and how big a percentage does incident involving people with disabilities? Thank you, Chair.
Thank you, Honorable Malika. Over to you, Minister.
Thank you very much, Honorable Malika, for that question. And first and foremost, upfront, I do want to say that the issues of people with disability still remains a challenge in our country overall. And then the call that the Department of Social Development always makes is that it is beyond the Department of Social Development, that all government departments at national, provincial, and local have to really upscale in supporting people with a disability. Yes, there was an increase in the number of persons accessing psychosocial support services in 2020 as opposed to 2019. There are various reasons that may account for this increase in number of persons accessing our GBV Command Center. One, which was the hard lockdown since March 2020, where many people found themselves in confined spaces, threatened by joblessness, loss of jobs, and loss of lives and livelihoods. And therefore, the center did receive much higher numbers in comparison. We've got figures that indicate between January and December 2020, we are at the moment, the percentage, if I may say, it above it's data that we have indicates exponential increase of over 50% in calls to the center during this period. We do have information which can be submitted in the form of tables that we receive from the call center itself that indicate clearly this increase. It is also important to indicate that currently the data from the GBVCC is not disintegrated into terms of disability and other aspects. This, honorable member, we want to do so that we can be able to develop very responsive and direct interventions to the people in a disintegrated manner. However, I also do want to indicate that the department is working with the integrated justice system, which we call the IJS, and other partners such as Vodacom, who is our technical partner at the center, to close the gap, because we do believe that that gap must be closed, and technology is now enabling us to be able to do that. Thank you very much, Chair.
Thank you, Honorable Minister. The next follow-up will be by Honorable Christians.
Thank you, Deputy Chairperson. Thank you, Minister. Minister, regardless of the command center, South Africa's gender-based violence statistics are equal to a country at war. Statistics show that approximately 2,700 women are murdered every year in South Africa, and that 1 in every 3 women have been abused in their lifetimes. And in times of crisis, this has even increased to 2 in every 3 women, especially during the COVID-19 pandemic. The government must therefore also be honest with us and admit that not much is being done to eliminate the scourge of gender-based violence. There is a great need for more education in this country. It is time to stop asking women what to do and start focusing on the perpetrators. Men should speak out. Men, where are the men? Men should speak out against gender-based violence, and patriarchy should be eradicated. A concerted effort should be made. Minister, what programs, therefore, does the Command Center for Gender-Based Violence have in place to educate men and address the roles men of all ages can play in preventing and reducing gender-based violence? Thank you, Minister.
Honorable Minister.
Thank you very much, Honorable Christian, for that question. Firstly, the Command Center's responsibility is to receive calls and be able to respond to the people who are in distress, and women in particular, and children who are in distress. The responsibility of education and educating our communities around issues of gender-based violence, obviously a lot rests on the shoulders of government, and rightfully so, where government is supposed to respond by ensuring that it puts in place the correct policies and makes sure that there's proper regulation, but there's also infrastructure which women can easily access if they find themselves in distress. However, I do, Honorable Member, want to indicate that it has become very clear to us all in South Africa that the challenge of gender-based violence is something that we need to work on at a local level, strengthen the institutions of governance and the institutions of response by the women who are in distress. But beyond responding as the center responds, beyond responding, it is the responsibility of all of us collectively to do the best that we can, firstly, to make sure that the education that we are talking about is something that is done in homes, is something that is done within our communities. It is for this reason that the Department of Social Development, working together with the Department of Women, Youth, and People with Disability, working together with the Department of Justice, and as well as working together with the Department and the Minister of Police and SAPS in general, it is our task to make sure that this education we are talking about is education that doesn't happen among us. It is education that happens at local level. So our coordinated efforts with provinces, and in particular MECs of the relevant departments that I'm talking about, have effective programs where we talk to the people about gender-based violence. The Department of Social Development in particular has launched a program which is called Asikhulume. And this program, we are hoping that we'll be able to expand it so that it is us and the people talking among themselves to help us stop gender-based violence. But also it is our responsibility to work from a point of view of behavioral change, because part of the issue that you are correctly raising, where are the men? What are the men doing? I am happy to indicate that as a Department of Social Development, the majority of organizations of men who have stood up and said, not in our name, have gotten in touch with the Department of Social Development, together with the Department of Women, Youth, and People with Disability and the police. And I can assure you that the activities that we launch are not supposed to be only for the 16 days of activism. These are programs that are supposed to be 365 days in churches, in schools, on the streets, house to house, community to community. Collectively, we can be able to deal with gender-based violence, and including the private sector, and including your universities and all. This is a sketch that needs us all collectively, but of course, as government, we take responsibility where we have to take responsibility. Thank you, Chairperson.
Thank you, Honorable Minister. The next follow-up question will be by Honorable Ngwezi. Honorable Ngwezi.
Thank you very much, Honorable Chairperson. I believe this is question 206.
No. The question is 205.
205.
205 is
okay.
the first question. Yes.
Okay, thanks very much. Honorable Minister Makeba, in light of the increase of the number of cases of gender-based violence during the pandemic, whether the government has provided enough funding for shelters and other services for gender-based violence survivors in KwaZulu-Natal, and if so, what are the relevant details? Sifuna ukwazi lapha ezweni lesilo ukuthi akube zikhona yini inhlelo eziqondile ukunakekela labo abasuke behlukunyeziwe labezethu.
Ngiyabonga kakhulu.
Ngiyabonga, yes, Minister.
Ngiyabonga kakhulu, Honorable Ngwezi. Yes, ngiyathanda ukusho ukuthi kule viki elidlulile, in fact, bengise-KZN eThekwini in particular, ngathola nethuba lokuyobona ezinye zale ndawo ezisupportwa yi-Department of Social Development, kodwa ke futhi ezisupportwa amanye ama-departments. Yes, it is true ukuthi uhulumende uyazama ukuxhasa lawo makhaya lawo analabo bantu. Into engiyithande kakhulu kula makhaya engivakashele kuwo ukuthi amanye wakhona obviously are private but amanye wakhona are owned government. Okokuqala nje ngicela ukubonga abantu abahlala lapho babhekene nalenhlekelele yomama nabantwana abazithola bebaleka emakhaya bagijimela ukuyocasha somewhere. Into engiyitholile kule ndawo engivakashele ukuthi kunabantu abanenhliziyo, kunabantu ababheke ukuthi ababaleki nje omama abahlale kulamakhaya, sebayabafundisa nokuthi kufuneka baziphilise kanjani okokuqala. Okwesibili sebayabafundisa nama-skills development ukuthi bakwazi ukuthi mabephuma kulawo makhaya, mabephindela emuva, bakwazi ukuziphilisa nabo. Ngokusho kwami-ke ngasho ukuthi i-support esiyinikezayo ayikho enough ngokubona kwami. Kusafuneka ukuthi kube khona umsebenzi omningi esiwenzayo, siphinde sikhumbule nanokuthi-ke i-budget yethu ike yathi ukwehliswa, nako konke lokwehliswa kwe-budget kusiphethe kabi, kodwa soqhubeka siloku silwisa leyo nto ukuthi i-budget ibe khona. KwaZulu Natal in particular, ne-Gauteng in particular, ne-Western Cape, kancane-ke futhi ne-Northern Cape, yiwo ama-province okutholakala ukuthi ukuhlukunyezwa komama kukakhulu lapho. Kungako-ke sithi sifuna ukuthi ama-province, and ngiyethemba ukuthi honorable member masingathola ama-details sikunikeze wona, sibe very specific ukuthi i-KZN inamakhaya amangakanani and kwenzakalani kulawo makhaya. I-department ingakwazi ukuthi kunikeze leyo information. But ngokwami ukubona njengoba usho nje ubuza umbuzo oqondile ukuthi ku-enough na lokho esikwenzayo. Ngokubona kwami akukakabi enough. Kungako futhi siphinde sicele namanye ama-department ukuthi asincedise, siphinde sicele ne-private sector ukuthi sincedise. Sengivala ukucela futhi ukuthi i-economy yase-South Africa unfortunately i-monopolized kakhulu. So omama nalezinto abazenzayo baproducer lapho sebefundiswe khona. Ngithole ukuthi kule ndawo engiye kuzo eNatali e-KZN abatholi ukuthi bakwazi ukuzithengisa. Kungako-ke sifuna nokucela ukuthi kuvuleke, imakethe ivuleke for labo mama ukuthi by the time bephuma kulamakhaya bakwazi ukuthi kube khona nemadlana abanayo emaphoketheni wabo. Ngiyabonga.
Thank you, Honorable Minister. The last follow-up on this question 205, Honorable Zandamela. Is Honorable Zandamela available?
Yeah, thank you, Deputy Chairperson. Am I audible?
You are.
Thank you, Deputy Chairperson. Minister, South Africa's GBV problems are worsening. The extent and prevalence of the issues been compounded by the impact of COVID-19 pandemic. As lockdown measures have trapped women inside with their abusers, triggering a secondary pandemic. Which form of support does the center provide after it has received a complaint in an event of trauma? Thank you, Deputy Chairperson.
Thank you. Over to you, Honorable Minister.
Thank you very much, Honorable Zandamela. Yes, the GBV Center is not only there just to receive the calls. It has to make reference. Firstly, it refers even the cases to the police. It also refers to the department, and it also refers to your psychosocial support systems that are available in provinces. Yes, in my view, as I indicated earlier on, that we need much more social workers. And in my view, Honorable Member, the issue of social workers is something that we should take very seriously so that we can rather focus on prevention rather than dealing with issues and cases because the disaster has happened already. the call center does have a system of making proper referral. And as I indicated also, by the way, is that many of the callers can be cancelled through the center itself. But if the cancelling is not enough, the center has the capacity and capability of making referrals depending on where exactly the person who is asking for assistance is situated. We will, as a matter of fact, are looking at improving the system, including the fact that people who call the center, if there is a need for immediate action by the police or by any other social worker, we must be able to trace where the call is coming from. I am aware, of course, honorable members, that there is a challenge when it comes to the issue of tracing where the calls come from, because when all is said and done, it's important for us, as we receive the call, as the center receives the call, there must be an immediate reaction that does not delay. We are trying to improve the system from that point of view. Our psychosocial assistance is mainly based at provincial level. That is why we have the Department of Social Development at a provincial and a local level. We are trying as a department to make sure that our monitoring and evaluation and the impact thereof must be done by national. National must take the responsibility of doing that. But however, it is the provinces that need to strengthen their systems in order to make sure that people are assisted not only at the call, but they are assisted throughout the period, because there's got to be a healing, there's got to be support, but there's also got to be empowerment of the women and children who have been affected. Thank you, Chairperson.
Thank you, Honorable Minister. That dealt with question 205. We will now go to question 199. That is asked by Honorable Christians. And over to you, Honorable Minister, for the response. Honorable Minister, you are muted. Oh, thank you.
Thank you very much, Chairperson. May I also upfront indicate, Chair, that I was sitting throughout the responses of the Deputy Minister of Health, and the system keeps going up and down. Sometimes I lose you, and sometimes it gets muted without me muting it. So I wish to apologize upfront if it so happens that I find myself in the same situation. With regard to the question from Honorable Christians, the answer, Chairperson, is that the Northern Cape renders services in 52 local offices and 153 service points. For areas not covered by the local office and services rendered at service points, the Integrated Community Registration Outreach Program, which in short we call ICROP, is used as a response to increase SASSA services within the 5 districts. A and B, Chairperson, although SASSA has an extensive footprint in the Northern Cape, also appreciating and understanding the vastness of the Northern Cape through which services are provided, there are 2 new offices under construction, which is part of our expansion plan. These are in the John Diaulo Kaintsiwe district. The local office in Tsineng will be completed in February 22, while the Batlaros local office will be completed in March 2022. These additional offices will extend the SASSA footprint in this area that has been rapidly developing. Both these offices will assist in preventing citizens from having to travel to Kuruman town for services. But I also do want to indicate, Chairperson, that as we continue to look for better ways of servicing our people, I have from the very beginning, together with the Deputy Minister, have indicated that we are wanting SASSA and the department in its collective to upscale the support that we give to our people, try the best way that we can to bring the services closer to our people. We know that that is costly, but we need to give dignity to our people to avoid the long, endless queues where our people have to be there for a very long time. And lastly, Chairperson, the experience we've had during this period of COVID-19 has clearly indicated to us that it is possible to use technology to solve some of the challenges that we face. And it has also been proven that it is possible for our people to get used to using technology so that it becomes easy for them to access the services of SASSA. I thank you, Chairperson.
Thank you, Honorable Minister. Honorable Christians, any follow-up from you?
Thank you very much, Deputy Chairperson. Thank you for your response, Minister. Minister, South Africa is currently still battling the consequences of COVID-19, and it seems that things are set to become worse. Many people, young and old, do not have an income. And the past few months, we've really just seen people standing in line for hours for that 350 Rand social relief of distress grant. A high percentage of our youth are unemployed and continue to have no income, and that is also set to increase. What is the latest update, Minister, on the basic income grant as a way of leveraging poverty, hunger, and unemployment in South Africa? And additionally, will the 350 Rand be extended past March 2022 in light of the rise in COVID-19 cases, which could signal a fourth wave and a possible lockdown? Thank you very much, Deputy Chairperson.
Thank you, Honorable Christians. Over to you, Minister. You are unmuted again. Can you, is it, yes, is it?
Thank you. Is that better?
Yes, no, we understand. We understand the challenges that you are experiencing. Please, over to you, Minister. We hear you now.
Thank you very much, Honorable Christian, for that number. And I must upfront be able to thank some of the members of the NCOP, as well as the members of the National Assembly, who stood up to support the department from the very beginning when we started the discussions about the basic income grant, and to also indicate to the honorable member that, yes, we are continuing with our quest towards ensuring that ultimately this is adopted. But at the same time, we are very conscious of the financial challenges and the impact thereof on the fiscus. But as a Department of Social Development, we are saying it would be better for our government, our people, to support those that are finding themselves at the lowest end of development, but also unemployed, those that are not finding jobs, even if they want to go out and find jobs. The discussion around the basic income grant is still on. We have not abandoned it, and we have no intention of abandoning it. And I think that we've got a greater support. In fact, we do have support even amongst a government itself, because there is a full appreciation and understanding that when too many people go home hungry, when too many people have got absolutely nothing, it is not in the good of our country, neither is it in the interest of peace, security, and stability in our own country. At the same time, Chairperson, we are conscious of the fact that the best way that we can also work towards ensuring that lives and livelihoods are taken care of, it's about growing the economy of South Africa. So while we talk about the basic income grant, we are not excluding ourselves from the overall discussion about the economic development of the country, about the economic empowerment of women. It's about the opportunities that need to be presented to our people, working together, government and the private sector, ensuring that we grow the economy of South Africa so that South Africans can be able to go out there either to get the jobs or to start their own businesses. We also support cooperatives and small and medium enterprises so that South Africans can actually be able to work for themselves. With regard to the 350, you are aware, Chairperson and honorable members, that it was extended until next year, 2022 in March. And again, I do want to indicate that as a Department of Social Development, we did not wait. We are not waiting until the time comes that it comes to an end. We are in engagement to see if it is possible for it, considering the fiscus and the challenges, considering also the fact that COVID-19 is still here with us and it is not abating. And recently now we can see the figures. So we continue to present to our own government, present everywhere where we need to present to make sure that the 350 continues, depending obviously on the financial basket that government has. We've made those submissions as a Department of Social Development. I thank you, Chair.
Thank you very much, Honorable Minister. Honorable Du Toit, the next follow-up will be from you.
Thank you, Honorable Deputy Chair. Honorable Minister, I want to know, with regards to expanding SASSA services and the focus seemingly being towards the handing out of the 350 Rand grants, what steps are your department currently taking to rather teach people to fish than handing out fish? Thank you, Deputy Chair and Minister.
Thank you, Honorable Du Toit. Honorable Minister.
Thank you very much, Honorable Du Toit. As I indicated earlier on in answering the other question, we are not just a department that is looking at consumption. Firstly, let us start with the fact that most of what SASSA does is beyond the 350. It is about paying other social grants which are responding to our people. That is the elderly, the child support grant, as well as people with disability, including those that really cannot cater for themselves. So that broad statement is that we are not going to reduce the support that needs to be given to our people who qualify to get those social grants. And as you are aware, the payment of social grant is almost at 18-point-something million people. However, having said that, I indicated earlier on that as a Department of Social Development, in particular with the National Development Agency, which is our own agency, are looking at supporting NPOs and NGOs on the ground whose sole responsibility is to empower our people to skills development, but also to empower our people to be able to do things for themselves. What we would like to say, Chairperson, is that the issue of teaching people how to fish is not just something that can be done by the department alone. Overall government, our responsibility is to create a conducive environment for our people, as I said earlier on, to either get jobs and get to jobs, which unfortunately are not growing at the moment, but also to contribute towards ensuring that the economy grows. Just also as an indication, maybe I may say, Chairperson, is that within the people who have been receiving the 350, many of them are spending that money on basics, your bread, your meal, and the basic things. And so that money goes back again to the economy. And it is for this reason that as a department we're saying that money must also circulate within the rural areas, circulate within the township economy and all. But also there are a few men and women who decided to save that 350 and start some business one way or the other. The number might be very low, but the number will grow, because as a department, we also encourage our people to start looking at growing the very 350 that they are getting. And a few citizens have shown that it is possible for them to grow the money. I thank you, Chair.
Thank you, Honorable Minister. The next follow-up will be by Honorable Makause.
Thank you, Deputy Chairperson. Deputy Chairperson, rural communities in the Northern Cape face a number of challenges in accessing social welfare services. That includes the furthest point of the district of John Taulo communities such as Yenenflay and Madibeng areas. These communities rely solely, Deputy Minister, on social grants for a living. As a result, they queue from as early as 4 a.m. in the morning at ATMs in the Kuruman town. These recipients experience increased travel costs and the distances are too long. in reaching the nearest points, which are mainly situated in the center of Kuruman? What initiatives are there to assist these recipients without having to travel such long distances to access the little that government is providing to them? Thank you, Deputy Chair.
Thank you, Honorable Mokause. Honorable Minister.
Thank you very much, Honorable Mokause. Yes, I fully agree with you. And that is why in my answer in the previous question, I was saying that SASSA, at both at provincial and at national and provincial level, has to keep looking for better solutions than having our people going and queuing this long. But I must also indicate, Chairperson, that you will recall that some of the services that we were providing, which were like cars and trucks that you used to go out and give this kind of service, we had to reduce them also because of the cost, but it doesn't necessarily mean that we're not doing that at all. But also the challenge is the fact that the security of these cars, whenever they go out with that so much money, they fall prey to those that attack them on the way. What I can say, Chairperson, is that, as I indicated earlier, that it's important for us to look for better solutions and bringing the services closer to the people. I did indicate earlier on that the people who are normally get the services in Kuruman, we are building the new offices which are supposed to, the new centers which is supposed to operate by next year. But what is much more important for us as a department, we are trying to have the one-stop centers where people can be able to go and receive the services of the department overall, social development, NDA, and SASSA, much closer to the people. The best is actually to ensure, and I know that members would say, look at what is happening with the post office now closing down. We are in serious discussions, obviously, with the minister in Chaveni about what is it that we can do. In fact, we're thinking that even some of the post offices that are being closed down, we can be able to use them and revamp them so that, because the post office really has got the biggest footprint in the entire country. We apologize, obviously, to those people who still have to wake up at 4 o'clock in the morning, get into buses, and many instances, they even have to borrow the money in order for them to get to the places where they get the money. In the future, our focus is how do we improve the systems and bring the services closer to people. In our view, there's nothing even wrong ensuring that our people, when they have to receive the money, that money can be accessed through your shops that are closer to the communities. But of course, that also has its own challenges of security and all that. But when all is said and done, honorable members, is that we have to, and we are looking for better solutions to make sure that we reduce the number of times that our people have to travel and bring it closer to the people. The majority of our people are actually accessing their money through the ATMs right now, quite a huge number of them. Some of them are accessing the money also through the retails, because then they don't have to be traveling those distances. But when all is said and done, we also need to make sure that this is brought closer to the people where they live, because even to go to the retail centers, they still need to get into a taxi and get there. Thank you, Chairperson.
Thank you very much, Honorable Minister. The last follow-up on this question will be asked by Honorable Ntube. Honorable Ntube, over to you.
No, thank you very much, Honorable Deputy Chairperson. I think I will succumb. The Honorable Minister has succinctly answered my question. Just to register a point, Honorable Deputy Chairperson, to the Minister, is that the youth of our country are calling upon your department and the government at large to declare the state of emergency on poverty and unemployment. Thank you very much, Honorable Deputy Chairperson.
Thank you, Honorable Ntube. Minister, do you want to say anything on that?
Yes, though I do wish to thank the honorable member, especially because the issue of unemployment for young people has really reached intolerable proportions. And again, as I was answering the question, our focus as a Department of Social Development, we are contributing towards the discussion and the debate, because if we look at the breakdown of the figures in terms of who is applying, for instance, for the 350, in the majority is young people. We've even broken it down, Chairperson, to appreciating if it is young people. Is it young people who finished their matric? Is it young people who've finished university? Is the unemployed, what figure of the unemployed and where are they? We are hoping that the recent research, SNAP research that was done, we can be able to also give it to the other different departments whose sole responsibility is to look towards creation of jobs. A focus has to be on young people because they are the future, they are today and their future. And I do appreciate and agree that we need to focus on young people. I thank you.
Thank you very much. Thank you, Honorable Ntube, Honorable Minister. We are going to question 206 as asked by the Honorable Nchabaleng, and we will request the Minister to respond thereto.
Thank you very much, Honorable Chair, and I thank Honorable Nchabaleng for that question. Chairperson, let me start by indicating that the ECD stimulus relief is part of the Economic Reconstruction and Recovery Plan, which we term ERRP, that is geared at providing relief measures as a result of the pandemic. And again, I'm hoping that the young people of South Africa are aware of what the ERRP is and the different sectors which are being supported by the government. It is also part of the presidential economic stimulus package designed to respond to the rise of unemployment caused by COVID-19. And therefore, an amount of 496 million was allocated to the ECD sector as an unemployment risk support to compensate 108,833 early childhood development related workers who lost income as a result of COVID-19. 2% of the funds, therefore, was for administration. Given the informal nature of the sector and the fact that the department did not have a full database on the ECD workforce, a web-based system had to be developed for the central application and verification purpose to ensure that only the rightful qualifying recipients receive the support. I have also been ensuring that with the provinces, because it is the provinces that have to make sure that they pay the qualifying ECDs. And yes, indeed, the stimulus fund, which is part of the presidential stimulus package, although not yet completed, has recently been able to achieve its intended purpose. To date, 64,094 ECD staff have been approved and processed to the provinces, with almost 42,739 have already been paid within a value of 179 million. The provinces continue to make the payments on a daily basis for all approved recipients of this program. It is important, though, to highlight that through verification, there has to be conducted to ensure that public funds are paid to the right people. And I must indicate, Chairperson, that even during the period of the campaign for local government elections, I visited quite a number of our provinces and even had some of the meetings with the ECD practitioners, many of whom complained bitterly that they had not received the money. I have put this on the agenda with all the MECs of the provinces to make sure that we get the report whenever there is this meeting at provinces, because it's the provinces that need to pay. But also, I do want to indicate, Chairperson, that the challenges of unregistered ECDs is a big problem for us, and it should be a problem for everybody, because we cannot have people that have ECDs where they are not properly registered. There's no monitoring exactly what happens at the ECD. And when we know that the Early Childhood Development Center should be properly registered so that we know what is happening with the children at ECD centers. We will continue. We do have a special program called Bangasali, where we are encouraging ECD centers to really go and register their ECDs, because we cannot also be paying people who do not have proper banking accounts, people who do not keep their books in order, and yet they demand that they get the money. Once you put your systems in place, we also even go to a point of helping the ECDs to put their systems in place. It's not that we dump them because they are not registered. We have systems of assisting them to make sure that they are properly registered. Thank you, Chairperson.
Thank you very much, Honorable Minister. Honorable Chabaleng, do you have any follow-up question?
Thanks a lot, Deputy Chair, and let me take this opportunity to appreciate and thank the Minister for always being there when we want to meet her with her as the committee, and at the same time, for having performed very well. Minister, I've heard your response to my question, but what I want to know is, when are you going to finalize this early childhood development payment of this stimulus relief fund for ECD people?
Over to you, Honorable Minister.
Thank you very much, Honorable Chabaleng, including
Honorable
your
Chabaleng,
kind...
mute, please. Chabaleng, mute, please. There is some feedback. Thank you. Sorry, Minister. You may continue.
Thank you very much, Honorable Chabaleng. I also thank you graciously for your comments. As it is now, I tested positive and I was like, oh my goodness, I've got these questions to answer, but I'm feeling a little bit better. So I needed to present myself here, and it's the end of the year, so members would want to go home to their constituencies with the answers. Yes, let me emphasize that our intention is to ensure that all qualifying ECD services are paid as soon as possible, as we recognize the importance of this support. It is important to note that payment is done by provinces, and I indicated earlier on, I've really been sitting on the necks of the MECs as well as the administration, and I've also been pushing the acting DG to work closely with the heads of social development at the forum to make sure that these payments are being paid. We have to ensure that the payments are paid before the end of the financial year, because you know that when monies are not being paid, Treasury also puts pressure on us because that money has to be taken back. So we have made the announcement that ECD operators have until the 15th of December as a final call to update and correct their information. Those that have corrected their information will receive their money. And I'm sure that the provinces, because it is in the interest of the provinces also that the resources go to the right person. We are quite worried about the 6,127 ECD programs that failed bank verifications. It cannot be when in South Africa, the banks and dealing with the banks is no longer such a complicated thing from an application point of view. I'm not talking about other issues of the banks, but the banks also need proper documentation, need proper registration in order for them to open an account. And it was of disturbance actually to us as a department to realize that so many ECDs were operating not even with a proper banking facility. It's a problem because it means both parents, caregivers, and guardians, they must make sure that when they take their children to ECD centers, they take them to properly registered ECD centers. Thank you very much, Chairperson.
Thank you, Honorable Minister. The next follow-up will be from Honorable Lutuli. Honorable Lutuli.
Deputy Chairperson?
Yes, Honorable Arnold.
I'm going to stand in for Member Lutuli.
By all means.
The early childhood development sector has been hard hit by the COVID-19 pandemic due to prolonged closures, with some having been closed down and others losing their jobs as a result. Yet for many months, thousands of ECD centers in KwaZulu-Natal and across the country were left in the dark by the department as to whether or not their applications for the ECD Stimulus Relief Fund were successful or not. Minister, it's about assistance and it's also about communications, and you have mentioned that ECD centers have until the 15th of December to correct the information, but also from your department side, what are you doing to communicate the message effectively and assist those ECD centers with the relevant information? Thank you.
Over to you, Honorable Minister.
Thank you very much, Honorable Member, for that question. Yes, I fully agree. And communication is a two-way process. Communication cannot be a one-way process. However, because we are the ones who are rendering the services, it is important for us to make sure that we reach as many ECDs as possible. We have a database which was assisted by the fact that we started the Vangasali program. And by the way, the Vangasali program was not started because of COVID-19 or so. It is a program of the department where we also have partnered with the Mandela Foundation to assist us in reaching out to the ECDs and ensure that they respond as quickly as possible. Again, honorable members, I indicated that most of the work when it comes to the communication is done at a provincial level. But of course, we also do have to take responsibility as a department. We use all forms of platforms that we have within the department, including our website, including even sometimes getting opportunities through the GCIS, which is the government department communication, where we have interviews, we get the opportunity to speak through radio interviews, to just be talking to the ECDs and enabling them to understand and appreciate that when things are being requested on their side, they need to also take responsibility and speed up. And that is why, Chairperson, we didn't only just say, let them apply, and if they are unable to do that, we don't help them. We also do help them. In fact, I think this exercise has also given us a greater opportunity of working closely with the local government. That is why we also insist that the district development model is going to be able to assist that in our monitoring and evaluation, both at national, provincial, and local. What I would request, Chairperson, is that if members are aware, and the honorable member in particular is aware of some ECDs that maybe we might have not reached, it would be important for them to send the details to us so that we can then be able to reach those that we have not been able to reach. But we've done our best through our provinces to make sure that the MECs and the Department of Social Development are aware who has not been reached. I thank you.
Thank you, Honorable Minister. The next follow-up will be by Honorable Ngwezi.
Honorable Chairperson and Honorable Minister, I would like to know whether the department can provide relevant details on the rollout of the Early Childhood Development Employment Stimulus Relief Fund across provinces in light of the allegations that only 25% of the funds have been spent out by the September 2021. And if that is the case, what are the relevant details? Okay.
Honorable Minister.
Thank you very much, Honorable Ngwezi. Yes, the department can be able to provide that information, because recall that even earlier when I was giving the statistics, I was being very specific about the number of workers who have been able to receive the stimulus package. We can be able to submit in full
that information, because it will be just a question of giving what we already have, but also it will be requesting the Department of Social Development at provincial level, including the MECs. I can easily ask them to submit the information, and then we can hand over that information to yourself or to all the honorable members as requested. I thank you.
Thank you, Honorable Minister. The next follow-up will be by Honorable Isaac Sileko.
Good afternoon, Deputy Chair. Good afternoon.
Honorable Sileko.
Minister, thank you very much for the information in terms of the statistics of who has actually benefited out of this whole program or this package. But Minister, can you please just enlighten the House as to how many have not received funding? And are there any ECD centers that had to shut their doors permanently because of lack of income? If so, how many? And will they be assisted in the future to enable them to open their doors again? Thank you very much.
Thank you, Honorable Sileko. Honorable Minister.
Thank you very much, Honorable Chairperson and Honorable Sileko. Yes, there are ECDs that fell into a very difficult situation because of COVID-19. However, I'm not able to give specific figures. And again, it will be a question of me getting the specific figures. And even then, we can only be able to give the figures of those ECDs which we have indicated are registered ECDs, which we monitor as a Department of Social Development. And yes, for those that have not been paid, they will have to be paid. And yes, those who ended up having to close down, one takes it that there was a purpose and a reason why they opened in the first place. And of utmost importance to us as a Department of Social Development, and I think also to the Department of Basic Education. And by the way, the process of ensuring that the ECDs are handed over to the Department of Basic Education is ongoing and is quite far. We're hoping that by next year, that process would have been completed from an administrative point of view. And yes, as a Department of Social Development, we would like to support those ECDs that ended up closing down because of COVID-19. Yes, we would like to support the parents, the caregivers whose children ended up not being able to go to the ECD centers because of COVID-19. And again, honorable members, the reason why recently when President Cyril Ramaphosa made the announcements that he made with regard to where South Africa is in terms of COVID-19, the continuation of life and livelihoods does not only include the businesses, it also includes the issues of schools and children being able to go to school. It also includes the ones of the ECDs and ensuring that life continues, but obviously taking serious consideration as he indicated about the issue of vaccines and all. We would like as many as ECDs to be open as possible. We would like to support as many ECDs as we possibly can because we cannot afford children who are unable to go to ECDs. Not long ago, Chairperson, I was in an area where my grandparents come from and where my family comes from. And it was a pain for me to see some of the children in the homestead playing around and me being told that, Minister, you are here, these children have got no crèche to go to, not because the crèche is closed because of COVID-19, but as a matter of fact, there are not enough early childhood development centers in the rural areas. And I took that at heart, Chairperson, because no place in South Africa, whether it's in Kazache, in the deepest rural of KZN, deserves not to have ECD centers because, and I could see many of those children are very bright. Many of those children deserve to be in early childhood development. So we'll do everything we can to make sure that early childhood development is accessed by all ECD children who are supposed to go to early childhood development. Thank you, Chair. Thank you, Honorable Minister. Thank you also for the other question. We are going to question 194 as asked by Honorable Arnolds, and we will give to the Minister to respond to the question.
Thank you very much, Chairperson, Deputy Chairperson, as well as the Honorable Arnolds of the Western Cape for asking this question. Chairperson, we must be concerned about the number of gangs in our country, especially those that include our youth. Our youth must be assisted, must be helped, must be supported by all of us about the dangers of joining gangsterism or being part and parcel of gangs, and they must be assisted in appreciating and understanding how this really ruins their future and ruins their life. In fact, as a Department of Social Development, we have to work with our communities, have to work with our other departments, the Department of Police, the Department of Education, and all other relevant departments, including the Department of Justice. What I think is the biggest problem and a greater challenge to us with the issues of gangsterism is the fact that sometimes it ends up being glorified for young people, and in many instances, futures are destroyed just by a decision by some young person being influenced by others. And again, to me, as a Minister of Social Development, points out to some structural challenges that we continue to have with regard to where our people live, how our people live, what is the environment under which our people live, the conducive environment under which our people, both old and young, live, where this whole issue of encouragement of gangsterism can be reduced, in fact, eliminated completely. In August 2012, the Portfolio Committee on Police requested Civilian Secretariat for Police to draft National Interdepartmental Anti-Gang Strategy to address the issues of gangs and gangsterism in our country. We work together with them. The Justice, Crime Prevention and Security Cluster, JCPS DGs, in March 2013, tasked National Intelligence Coordinating Committee, NICOC, to set up a task team on gangsterism, and my department was part and parcel of that. And it is against this background that my department developed a DSD anti-gangsterism strategy for children and youth at risk and in conflict with the law. And as part of this strategy, we've been able to train and capacitate a number of probation officers and officials in child and youth care centers, secure care on this strategy, including popularizing it with the sector. We prioritize these centers as they house awaiting trial and sentenced children, but also because we have seen heightened incidences of bullying and gangsterism in these centers. Chairperson, the Deputy Minister and myself have visited many of these centers, and I do believe that there's still a lot of work that needs to be done at these centers, including the skills development at these centers. But it is about giving young people hope. And when young people can't see hope, when the nation can't see hope, the issues of children getting out of the way and joining gangsterism is even better. Working with Provincial Department of Social Development and stakeholders in sectors, we implement a number of social behavioral change programs which the Deputy Minister, MECs and I champion. These include, but not limited to, YOLO, which means you only live once, targeting young people aged between 15 and 24, encouraging them to make the right choices in life by providing them with options to improve their own lives. The other program is CHOMI, targeting young children between 10 and 14, also aimed at young people aspiring to have good role models in life. The other one is Kimoja, an everyday hero, which addresses the challenges of substance abuse. One of the biggest challenges we have, Chairperson, is that of substance abuse. And as you are aware, as a Department of Social Development, we need to connect and work closely with other departments to make sure that we deal with this scourge of substance abuse. And one of the weaknesses I've seen also, Chairperson, practically myself, in visiting many places, we have these very good centers which we keep and children going there. And again, when they come out of these centers, they are confronted almost with the same challenges they had before going into these centers. It is for this reason, as a Department of Social Development, that we want to coordinate and act together and create a conducive environment so that when they come out of these centers, they don't fall back into what took them to the centers in the first place. Thank you, Chairperson.
Thank you, Honorable Minister. Honorable Arnolds, do you have a follow-up question?
Thank you, Deputy Chairperson. The impact of gang-related activities and the burden it places on our health, law enforcement, correction, social and education system are significant. By preventing youth from joining gangs in the first place, we need to significantly improve their chance for a safe and productive life. Faced with the current economic realities, prevention is the best way to stop the cascading impact of gangs on our kids, families, neighborhoods, and society at large. Minister, do you agree that the government's lack of a comprehensive, integrated approach is contributing to gang activities? Thank you.
Over to you, Honorable Minister.
Thank you very much, Honorable Member, for that question. Yes, at the center of the work that we have to do is prevention, prevention, prevention. And prevention has to be a responsibility of all three spheres of government, first and foremost, coordinating properly with the already existing comprehensive plan that we have. It's one thing to have very good comprehensive plans that can be applauded by everyone else in the country, but it's another when it comes to ensuring that there is that implementation. It is for this reason, Chairperson, that also government itself recognizes the weaknesses within the system, hence the call for a proper coordinated cooperation at the three spheres of government, but mainly the agreement at national level, provincial, and the launch of the district development model, which will enable us at a national and provincial government to put more resources, both human and otherwise, in ensuring that the local structures where the most immediate need is, that's where we need to go. It is this very government of the African National Congress who recognized the weaknesses, as you are indicating the weaknesses, Honorable Member, and we accept and we agree that these weaknesses do contribute to a lesser impact of our work if we are not properly coordinated. And it is for this reason that we believe that working in silos will never assist, and working in silos would never have a greater impact which can be visible to the local people. And therefore, the safe and productive life begins with the creation of a conducive environment from the time that a child is born. That's why we have a program we talk about from cradle to grave. We must make sure as a Department of Social Development that our social services cater from the beginning to the end. But most importantly, we believe, and I believe personally as a Minister of Social Development, that if we are not coordinated, we will never be able to have an impact. Our programs will never be able to have an impact. But lastly, Chairperson, I think it is important for us to also appreciate the importance of supporting families. And again, our department is one of those departments whose also responsibility is to ensure that we have safer families, we have productive families. And again, we cannot do that alone. We have to work with other departments. It's important for also parents to take responsibility and begin to ask for assistance way long before the danger arrives, because if parents also do watch out the behavior of the children when they are at home, they would be able to pick that up. And lastly, Chairperson, our quest as a Department of Social Development to have more and more social workers in schools, not just one social worker in a school, especially in the schools where we know that there's more trouble. We need more social workers because it's a burden for one social worker to be in a place where we know that there's greater challenges. The Western Cape being one of those places, we work, we push for the provincial government, all the different departments at provincial government to really respond to these challenges of gangsterism, but also ensuring that the creation of a conducive environment for these children is created by government overall. I thank you, Chair.
Thank you, Honorable Minister. The next follow-up question will be from Honorable Dutoy.
Honorable Deputy Chair, I will be handling the question on behalf of Honorable Dutoy as he's currently in another meeting.
Okay, Honorable De Bruin, you may.
Okay, thank you, Chair. Honorable Minister, referring to the initiatives like child and youth care centers, as well as youth cafes that were established in 2017, are all of these youth care centers still operational? And with the millions of rand spent on these initiatives, would you say that it was a success? Thank you.
Thank you, Honorable De Bruin. Honorable Minister.
Chairperson, the success can only be seen through ensuring that we have less and less children who have to end up in these centers. The success is when children can remain within their communities. The success is when, as I go back again to the issue of creating a conducive environment for families to thrive, for communities to thrive. The success for me as a Minister of Social Development is having less of these children being found in these centers. To that question also, I do not think that some of the centers are operating optimally. I do not think that some of these centers give value for the money that is being spent by the Department of Social Development. That is why we as a department, and in particular myself, has said we need a stronger monitoring and evaluation system, a system which can give us comfort both at national and provincial level that the money that's being poured into these centers, really there is value for that money. It's still a long way, if I may be very frank. It's a long way before we can actually say all the centers are operating optimally. I have visited some of the centers. I found the children to be in poorly state, and I have demanded of the department that we improve our monitoring and evaluation. But the monitoring and evaluation can also be assisted when some of the parents who do visit these children, and again, it's a question, some children are visited by parents because the environment is created for them to visit some of these centers. Some parents do not visit the children for a very long time. And again, this is a problem that can be resolved by all of us working together. But at the end of it all, it's also about the department having proper systems in place of ensuring that there is monitoring and evaluation. My view is that at a provincial level, there's got to be much more vigorous visits to these centers to make sure that there is value for money. The Department of Social Development spends a lot of money on non-profit organizations that we are supporting. And again, we can give the exact figures to the member about who are we supporting in each province and how much is being spent on each, because those figures are there. But the amount we're spending of almost 82 or 80 something billion per year that we spend on NPOs, I have demanded from the department that I need reports so that we can see the value for that money through the impact. And the impact is the results of how many children in the center are coming out having fully recovered, or how many of the children in the centers are getting out of the center and going to normal life. Normal life is the best way for any child or for any person, is a normal life and not be stuck in centers. I thank you.
Thank you, Honorable Minister. The next follow-up will be from Honorable Bratteseth. Honorable Bratteseth.
Thank you very much. Honourable Deputy House Chair. Minister, thank you so much. And I certainly hope you recover fully from your current COVID infection. Minister, if the fraudsters in this matter are known, then they clearly are in breach of the trust relationship with their employers. Other than recovery of the funds, have disciplinary charges been laid? Have they been suspended? And finally, have criminal charges been laid against these employees? Thank you, Minister.
Thank you, Honorable Bratase. Over to you.
Chairperson,
Yeah.
Chairperson, I need the Honorable Bratase to just indicate, because she's talking about fraud and he's talking about fraud and he's talking about whether people have been charged. Is it in relation to the youth care centers that we are talking about? If he could please indulge me with an explanation. I just missed that point.
Honorable Bratase, if you don't mind, please.
Chairperson, I was asking the question in relation to question 190. Perhaps there's been a confusion on the question.
Yeah.
Can you help us there?
Can the table just assist with 194? Because the question that are currently being responded to is 194. It's 194.
My apologies, Chair. I think I was incorrectly placed as a follow-up on question 194. I'm actually referring to question 190. I'll come back to that shortly. Thank you.
Thank you, Honorable Bratase. Honorable Ndongeni, you will be the next to ask the follow-up question.
Inkosi Makeba, ube right man ufuthe iphume lento nayo. Nangu umbuzo endinawo. Thank you for you, Honorable Minister, for your response to the question. Is the monitoring of the implementation of the anti-gang strategy in secure care centers yielding any results? Thanks, Chairperson.
Thank you, Honorable Ndongeni. Honorable Minister.
Thank you very much, Honorable Ndongeni. In my view, I don't think we are yet doing enough. It is about creating systems that will enable one to, maybe sometimes even with the touch of a button. One of the reasons why I am saying that we need to use technology to respond to the challenges that we have within our governance institutions is to make sure that the monitoring and evaluation does not take very long. I cannot honestly say here I'm happy with the monitoring and evaluation. I think that we can still do much more. And I think the provinces in particular can do much more. One of the things that I think is very important is about enabling even the people who are in these centers to have either a box or where they can even put their complaints so that they can be easily followed. But what I know for now is that since I came in as a Minister of Social Development and the Deputy Minister, Bokopane Zulu, we have not yet received your drastic information that points to drastic situations and bad situations. I can say that the people who are managing these centers, and I must thank them because it's never easy to manage these kind of centers, especially sometimes when you get budget cuts and all that. But in my view, I think that we'll still have to do much more in creating a system of monitoring and evaluation. But it's also not just about creating of a system of monitoring and evaluation. It's also being able to respond, because we're responding sometimes is about one, ensuring that we have adequate staff in those places. Two, we've got adequate equipment, and I've been to some of these centers and I've seen that from issues which might be taken for granted, that the washing, the dry cleaning and all that, the food that is being distributed or that is being given to these children, and ensuring that people who are working in the institution are also very accountable. I think there's still room for improvement as far as I am concerned. Thank you, Chair.
Thank you very much, Honorable Minister. They dealt with 194. The next question will be question 200 or 200 from Honorable Christians. Over to you, Honorable Minister.
Thank you very much, Deputy Chair, as well as Honorable Christians for that question. In response to A and B, as the department, we remain concerned about child protection issues and more so issues relating to child labor. And we strongly condemn any practice, particularly during this period of 16 days of activism of no violence against women and children. It is important to note that child labor matters are dealt with within the context of child protection. And I think, Chairperson, again, one might also make reference to the fact that according to Basic Conditions of Employment Act, it is criminal offense to employ a child younger than 15 years. But also we have the Children's Act, which we can also refer to, and that the law says that children need to be protected from different types of neglect or harm. And also we are signatory to the UN Convention on the Rights of the Child. And again, honorable members, it's one thing to have these good documents and us being signatory to all the international conventions around the protection of children. It's another in ensuring that children are protected right in the home, right on the streets, right in schools, everywhere where children are. And therefore, prevention through education and awareness raising on what is child labor and its different forms is very important. As part of the education and awareness raising, the department implements a 365-day child protection program of action that empower parents and children and caregivers on the care, safety, and protection of children. Different media platforms such as social media, web-based seminars. Of late, we've been using webinars, online, TV and radios are being used to reach all children, parents, and communities, even in the remotest areas of our country. The department works with other key stakeholders, which include other departments, such as the Department of Basic Education, Labor and Employment, Subs and Justice and Constitutional Development. The department is a member of the implementation committee that the Department of Labor chairs for the purposes of identification of cases, reporting of child labor cases, and coordinated responses. The coordinated response includes ensuring safety and well-being of the child if the child is at risk. One of measures by DSD is the removal and placement of child in an alternative care where parental or caregiver support is inadequate to care and protect the child. Provisions of counseling and psychosocial support. Furthermore, working with SAPS and the Department of Justice, perpetrators are also prosecuted. The department further developed guidelines for prevention and response to child exploitation. And in this regard, training is being conducted with key departments focusing on their roles and responsibilities, including identification and reporting on child labor practices. On the onset of COVID-19 pandemic, the department, working together with key stakeholders in the children's sector, developed COVID-19 child care and protection responses plan. All government departments report to the National Child Care and Protection Forum, which is the NCCPF, on a quarterly basis on progress made to implement this plan. And again, I do want to indicate, Chairperson, that myself and the Deputy Minister visited many of child care centers, including the ones where children are kept closer within the communities. And that's one of the programs that I really appreciate a lot, because the children are kept within homes, and those homes are within communities. Because I personally believe that the seclusion and the keeping away these centers too far away is one of the issues that we need to deal with as a department, but in society as general. Children have to always be within communities. I thank you.
Thank you, Honorable Minister. Honorable Christians, is there any follow-up from your side?
Yes, thank you very much, Deputy Chairperson. Thank you for your response, Minister. Minister, among the various groups affected by the global pandemic, as you've also rightfully mentioned, children remain one of the worst hit across the globe. The pandemic has triggered a massive increase in the cases of abuse and violation faced by children in South Africa, but also across the world. Children in the age group from 18 to 19 years who dropped out when the schools closed due to the pandemic show high probability of not returning to school. Now, as the Minister also rightfully mentioned, that it takes a community. Now, does the Department of Social Services have additional commitments within communities in order to discourage child labor in South Africa and get our children back in school? If so, Minister, what are these programs within communities and what have been the successes and challenges to date? Thank you, Minister.
Honorable Minister.
Thank you very much, Honorable Christians. I think one of the reasons why it is in the responsibility of the provincial governments to ensure that this encouragement is made through the centers that we have. By the way, it can also even be through the feeding scheme centers that we have as a department across the length and breadth of the country. It is the information that has to be communicated within those centers where children have to go. But it is also the communication that we need to do as a department at provincial and local level. I am sorry that maybe I might sound like a scratch record when we talk about the issue of ensuring that the support services that we have must be strengthened at local level so that the national department can focus on policy issues, can focus on developing the right strategy, but also can focus on the monitoring and evaluation of these processes. Yes, we would like, and we make the call. In fact, may I indicate that during the local government campaign that many of us went out, I spent a bit of time, particularly in the Northern Cape, and targeting the Northern Cape was simply because I felt like sometimes the Northern Cape does not get our attention that much, and I spent so much time there. But what I appreciated was the work that is being done by the province, but also liaising with the local government structures to focus on the school dropout. And one of the things that was quite painful for me, and I think the department will need to focus on this, is in the Northern Cape, if you look at the number of children that are out there and the number of young mothers who are having children at an early age, which causes also the dropout. For me, it is about ensuring that the NPOs and the NGOs who are focusing on this kind of work being supported by the Department of Social Development, not only from a material point of view, but also from a financial point of view. It's important that we work very closely with them, but also bring on board the schools. The weakness that I have found here is the children go to school, and then while they're in the hours of school, everything seems to be going on well. The minute the children leave the school, they are almost on their own. We need to create more facilities where the children can go to after school while their parents are at work, those that are at work. But also, I realized that in the Northern Cape, most of our people who live in the different communities, you get to a community and they tell you that 95% of this community entirely depend on social grant. This is where I think we need to be very creative. And I've said to the department as well as SASSA, let us use the data and information that we have about these children, some of whom are children who are going to school and paid for by the Department of Social Development or are going to non-fee paying schools. Let us use the data that we have and begin to segregate the data in such a way that we must be able to know almost each and every individual child. What do they do when they come out of school? What do they do when they get home? In fact, I was saying, what's the point of us coming to a community and helping the community? You see the children are being given little books to read. They are being given support when they come to the centers, but we don't know what happens when the children go back to school. You have all the fancy things that are on the wall, teaching the children what needs to be done. As soon as they get out of the school, their road back home doesn't reflect the same thing that was reflecting at the school. And then when they also get home, there's nothing on the wall that reflects the same thing that the children were getting when they were at school. So this is a journey that we all need to travel and make sure that children are taken care of, not only when they are at school, but they are taken care of even in the homes. Parents can buy some of these things, or parents can even get some of the things that are motivational for the children. And parents can actually draw some of these things and put them on the wall, because they drop their children at school. They can see what is happening at school. They can also be creative to make sure that the children are motivated even when they are at home. Thank you, Chairperson.
Thank you, Honorable Minister. Honorable Malika, you will be having the next follow-up.
Thank you, Deputy Chairperson, and thank you to the Honorable Minister. Honorable Minister, what is the composition of the National Child Care and Protection Forum? And how does this composition assist in prevention and response to child exploitation? Thank you, Chair.
Thank you, Honorable Malika. Honorable Minister.
Excuse me, Chairperson. Excuse me, Chair.
Yeah, you must drink hot water. They must give you hot water. Take into account that she's speaking for a long time and she's not well.
Thank you. Thank you very much, Chairperson. The National Child Care and Protection Forum, which we call the NCCPF, comprises of national government departments, provincial departments of social development, national NGOs, institutions of higher learning, Center for Child Law, and I must really say that the Center for Child Law and UNICEF in particular are working very close with us to ensuring that there is effectiveness in as far as this structure is concerned. This structure has been established in terms of the Children's Act 38 of 2005. The composition of the NCCPF ensures that there is uniform and coordinated approach in the prevention and response to child exploitation, sharing of best practices, while creating a platform for innovation that contributes towards the development of evidence-based program. Chairperson, this structure, in my view, we need again to keep on improving, basing ourselves particularly on evidence-based research that needs to be done. And I must also at this point thank both the Center for Child and Law and UNICEF for being available and also supporting us. In particular, UNICEF supports us a lot as a Department of Social Development from a point of view of doing research, because without research, we cannot be able to develop evidence-based program. But I will go back again, Chairperson, and say it's good to have these structures. It's good for these structures to also be innovative and be creative in a new way of resolving some of these problems. But when all is said and done, it's about making sure that the national NGOs also are properly coordinated, but also the national NGOs should be assisted to be very focused, so that when all is said and done, it's not about NGOs also quarreling over resources, and at the end of the day, us spending more money on the salaries and others of the NGOs instead of having really, really practical, impactful programs on the ground. Not that I'm complaining about NGOs, so that I must not be misunderstood. We really, really appreciate having NGOs because most of the time they are closer to where the people live. And also the NGOs are very relevant because they know the felt needs of the people that we are talking about. Thank you, Chairperson.
Thank you, Honorable Minister. Honorable Makause, you will be asking the next follow-up.
Thank you, Deputy Chairperson of the Council. Minister, the lockdown have deepened children's vulnerability in our society, as they have been subjected to worst form of child labor during the pandemic, including commercial sex exploitation, and are found begging in the streets. And sometimes even this begging influenced by their parents. Where is your partnership with the Department of Police in this regard? With social programs, Minister, proving to be inefficient in addressing the scope of child labor.
I've lost the member.
A minister, child labor during this pandemic, including sexual exploitation and forced begging. In some instances, being found that parents are standing with them, influencing them to do such. Where is your partnership with the Department of Police in this regard? With social programs proving to be inefficient in addressing the scope of child labor, which measures have been put in place to ensure that social programs are available, reach the intended beneficiaries? If I may cite an example, Minister, currently, the office in Kuruman has got one social worker which deals with drug and alcohol abuse. How about such programs, such important programs of child labor? Do we have to rely on a province of the Northern Cape to deploy people in the district to come and deal with such programs? Or when are you planning to employ more social workers, even more people in this kind of a program to deal with the situation? Thank you.
Honorable Minister.
Thank you very much, Chairperson. Yes, let me start with the issue of social workers. As a Department of Social Development, I want to make the statement that yes, we have trained a number of social workers and we have employed some of the social workers as far as it is possible. But I indicated earlier on when I was answering another question that my personal belief is that we need more and more social workers. We need social workers closer to the communities. We need social workers where we can direct and say in a particular street, the people of the street do have a social worker who works together with the different community organizations that exist in those communities. Yes, I agree, Chairperson, that it is something that is not adequate in as far as the work that we need to have, particularly with regard to the protection of children who are vulnerable. Children who actually are behind closed doors, are behind high walls, children who cannot be accessed, children who cannot be seen. But those children, when all is said and done, they do end up in schools, they do end up in ECD centers, they do end up in universities and a number of places. It is for this reason, Chairperson, that I do say we have not done adequately. It is not enough, the work that we have done, but as a Department of Social Development, obviously, we cannot be able to deal with this issue alone without the support. We do work closely with the department, with the police. We work closely with the Department of Justice. We try by all means to stop working in silos, as I indicated earlier on. We do our best in the best way that we can, but that best that we can, for me, is not yet adequate. And again, I go back to the question of the answer of saying, until such time that South African children are safe at every corner without being abused in their families or abused anywhere, until such time that we have systems in place that can be able to track and trace and assist the work, there's too much work that we still need to do. Thank you, Chair.
Thank you, Honorable Minister. The last follow-up will be from Honorable Ngwezi. Honorable Ngwezi. Honorable Ngwezi. Is Honorable Ngwezi still on the platform? Honorable Ngwezi.
It's not, Deputy Chair.
It seems as if we have lost Honorable Ngwezi. We will now go to the next question. That will be question 207, as asked by Honorable Gillian. Honorable Minister, you may respond to the question.
Thank you, Chairperson. Thank you very much, Deputy Chairperson, and thank you very much for that question. In response, SASSA has to date received just under 15 million applications for the Social Relief of Distress Grant, all of these through electronic self-help channels. I do want to take the opportunity to really congratulate the people of South Africa, those that needed to apply and they applied and they had the patience. Sometimes they put the wrong information and then it rejects them and they go back again to start from scratch. This can be very frustrating, but as I indicated, COVID-19 pushed us into the situation we are in, and there's lessons learned for the future. The fact that we can be able to do this, use use technology to address the challenges of our people and not undermine and think that our people would not always be able to use this technology. Well, this technology also is advancing very fast, and therefore it is important for us both as government, as a Department of Social Development, to connect to other departments that can be able to assist our people to learn more, understand more, appreciate more how to use technology. Of the 15 million applications which I spoke to about earlier, of these, approximately 9.5 million have been approved and paid. The payments for the first 4 months of the reinstatement of this grant is above 90% for each month. And again, here, members, when necessary, we can be able to give you the data, the information, who, where, in as far as the numbers that we are churning out here to have assisted. SASSA has taken note of the complaints and has implemented a number of measures to improve communication with the beneficiaries of the 350. This includes SMS notification advising them when they should collect the funds, ordering the queues by using the last 3 digits of the ID. And I know that this one was a problem of when do people get the information about the last 3 digits of the ID and when do they go? And I know that SASSA tried to improve that because the system wasn't working very well, because they were putting the 3 digits, for instance, on the wall of post office and all. But I think now they've improved the system. Ensuring an even spread of clients throughout the week, which also assists the post office with cash management. I know, Chairperson, that with regard to the issue of the post office, a number of post offices ended up being closed due to the challenges that are faced by the post office. We continue to have conversation with the department to make sure that the post offices does not run out of cash, especially because I know what it is when some of the people borrow money and they go to the post office and then they don't get the money. That's why we are looking for other alternatives. And I think I answered this question much earlier on. We're looking for other alternatives where people can have access to the money closer to where they live. The introduction of virtual card, which enables clients to access their funds from either Pick and Pay or Boxer stores. And of course, again, the question that we've been talking about here is how do we make sure that it's beyond Pick and Pay and Boxer, but people are able to access this money closer to where they live, including what Minister Nchaveni is working hard on right now, looking for solutions where people can be able to buy products even within the spaza shops where they live. And I think this is also another opportune moment for us to make sure that spaza shops are registered. Spaza shops also, many of them, the South Africans also must really stand up to owning these spaza shops and making sure that the same things that other people who own spaza shops are making the spaza shops work. We are encouraging our local people to take charge of this business because it is possible. Work is underway to sign up more retailers as well as some locally based spaza shop to expand this network, which will take pressure off the post offices. Multifaceted communication and marketing strategy, which includes the following, which are provided in all official languages: heightening social media response, constant engagement through community media platforms, mainly through the 30 most prominent community radio stations, community activations at strategic high volume areas such as taxi rank, malls, and others, constant updates to staff, mobilizing national and regional communications teams, which all give life to the one message and many voices. In addition to the above strategy, the customer contact center has been strengthened through a contract to bring in additional call center agents to respond to the calls, walk-ins, and email. We do have a call center chair, and I know many times some members would say, hey, but the call center people wait long to be responded to. It is because the call center was quite small, and we're looking at the expansion thereof. Thank you, Chairperson.
Thank you, Honorable Minister. Honorable Gillian, do you have any follow-up?
Thank you, Deputy Chairperson. Honorable Minister, let me thank you for your response. I think some of my follow-up questions you already answered. If we look into, sorry for that. If we look into the high level of people who apply for these grants, I just need to ask the one question, Minister. Are there any intentions to develop other self-help channels, and are there additional access channels being considered? Thank you.
Thank you, Honorable Gillian. Honorable Minister.
Thank you very much, Honorable Gillian. SASSA has to date received just under 15 million applicants for the social relief of distress, as I indicated earlier. SASSA is in the process of developing a mobile application to enable citizens who are, well, we can say technically saving, but I think that South Africans have proved that with the right gadgets, they can be able to use these gadgets to get responses to the questions and track progress with their applications. It is expected that this will be in place by January 2022. This is in addition to the website, which is the primary system for management of social relief of distress grant at this stage. And apart from this, the mobile app, SASSA is considering other alternative channels for all grant payments, which are cost-effective, convenient, and quick. As I indicated earlier, Chairperson, that COVID-19 has been a disaster for us all, but at the same time, COVID-19 has also propelled us into doing things that we never thought we were going to be able to do before. And therefore, if we don't take advantage of this window, which is also about the improvement of different apps and different systems, not only from a South African perspective, and of course, as a Minister of Social Development, I'm much more interested in ensuring that the systems that we use in South Africa must be homegrown systems, because I can tell you that if we look into comparisons as to what is happening in other parts of the world and the growth of technology and all, we are not very far behind as South Africa. No, I'm just talking about from a point of view of developing technological systems that can be able to assist us. And we are looking for homegrown solutions. And these may include payments through mobile phones, e-voucher, or similar electronic payments. Already there is a tender in place of being prepared for this to determine the options available and the costs associated with these electronic payment systems. Once we can increase on electronic payment systems, but of course, without losing sight of the fact that there still is a bit of a gap between the technology and our people who are in rural areas. There is that gap, and that gap we can be assisted as a Department of Social Development by other relevant departments, for instance, of science and technology, working together with them, the Department of Small and Medium Enterprises, working together with them in ensuring that we develop systems that are not going to frustrate our people, but develop systems that are going to make it much more easy. At the center of what we do now, and myself as the Minister of Social Development and the Deputy Minister, Bokopane Zulu, is about bringing back dignity to our people, ensuring that there's less and less of the queues that we see all the time, ensuring that services are brought much closer to our people. And technology is a big excitement for me, and I'm sure that the majority of South Africans would be excited also to access the services that we give to them easily using technology. I thank you, Chairperson.
Thank you, Honorable Minister. Honorable De Bruin, are you taking the question again?
Yes, thank you, Chair.
Okay, you may then.
Okay. Honorable Minister, are there any plans on the table to address the issue of the lack of ablution facilities at the post offices for grant recipients that wait in long queues and relieve themselves in public out of the fear of losing their spot in the queue? This issue is experienced throughout the country, and especially in Potchefstroom, JB Marks Municipality in the Northwest Province. Thank you.
Honorable Minister. Honorable Minister.
Mentioned that the problem in Potchefstroom in particular, I think I will have to speak to the MEC for social development in the Northwest to make sure that there is a follow-up. Again, Chairperson, yes, there has been challenges, and I remember very well the experience that I had, in particular in the Western Cape, where too many people were going to one place in Belleville in particular, and finding that the ablution facilities were not adequate. I immediately at that time, Chairperson, being there physically myself and seeing for myself, I made the demand and the call on SASSA to make sure that the ablution facilities are improved. I've also made the call again to SASSA to say that not only should there be just only ablution facilities, there's got to be chairs that are being brought where our people can be able to sit and wait, and where possible, even shade, because some of them stand there for a very long time. But I think what is exciting now, Chairperson, is that more and more of our people are beginning to go and access their social grants beyond just the post office. There's less people who are going to the post office. We engage also with the retail sector to say to them, the money is coming to you, by the way. So when the money is coming to Boxer or Pick and Pay and all, the profit goes to them. And therefore, we are making the demand to say them, give our people the best treatment, treat them well because they're bringing the money to you. You also have to take responsibilities and make sure that, one, there's also marshals who stand out there in the queues to make sure that people do not stand in queues for long without having to sit down, but also people keep to the social distancing. And also people, we must make sure that people wear their mask at all times. Many of the people who go to these centers, unfortunately for us, is the elderly, because the money comes to them. But when all is said and done, they're buying food and food products for their people at home. So the call has been made by the department, as well as SASSA in particular. And I wish to thank the CEO of SASSA here, because we really have crisscrossed the country despite all the challenges of COVID-19. We've crisscrossed the country to go to these centers and see for ourselves. Lastly, Chairperson and honorable members, we also had volunteers who were temporarily employed by National Development Agency to make sure that young people who are also at home get an opportunity as volunteers to go out there and be of assistance. We're hoping that we can extend this program, because when you have volunteers and they have the necessary gadgets, they have the calls that they can make to wherever they're supposed to call, to SASSA or the post office and all, we are then able to respond immediately to this. But the less we have of our people who have to go and stand in queues, the better for the future, in my view. Thank you, Chairperson.
Thank you, Honorable Minister. The next follow-up will be from Honorable Baha. Can the chambers be unmuted? Can the chambers be unmuted? You are still muted, Honorable Baha. Can they unmute the chamber? Advocate, can the technical people assist? Because the chamber is muted from what we see from the platform. Honorable Baga, do you mind that we go to the next follow-up from Moletsane and come back to you? And whilst they solve the issue. Honorable Moletsane. Honorable Moletsane. If Moletsane is not available, can the chamber please be unmuted so that we hear Honorable Baga? Advocate, can you please find out what is happening there?
Yes, I'm in the process of...
Honorable Baga, you may now continue. Honorable Baga, yes.
Oh yeah. Uyandiva ngokusihla. All right, thank you so much.
You are clear now.
Thank you so much. Minister, my follow-up is just to get a sense of where we are in terms of the disbursement of funds. In May this year, it was reported that the South African Post Office is in the process of permanently closing 130 branches across the country, including many rural branches. Should more post offices branches be closed, how will this impact the social relief and distress grant? And has another service provider been identified to administer the disbursement of funds? Thank you so much. Thank you, Deputy Chair.
Thank you, Honorable Baga. Honorable Minister.
Upfront, Chair, I must indicate that it is very unfortunate that we are in this state of affairs when it comes to accessibility of grants by the grant beneficiaries and recipients due to the closure of some of the post offices. But I do want to indicate that the post office itself indicated to us that it will, as a post office, look for alternatives of assisting in those areas. And they did indicate that it's not the main offices where there's quite a lot of traffic where they were closing the offices. But obviously, I do want to say that for us as a department and SASSA, and considering the fact that the footprint of the post office is quite huge, and the accessibility of the post office closer to our community is also big. But it is for this reason, again, Chairperson, that we're saying we need to find alternative ways for our people to access the grants, whichever grant it is. It's important for us as a Department of Social Development to ensure that the funds that are supposed to be dispersed are dispersed to the right people. We receive the fund, and then we pass on the funds to SASSA in particular. And of course, SASSA have got the different platforms that it uses for the payment of these social grants. We will continue to engage with the post office, but we are also of the view that where we realize that you're going to end up actually spending more money than is necessary, it's important for government to take the right decisions at the right time. But those decisions must not be decisions, obviously, that inconvenience the grant recipients. Thank you, Chairperson.
Thank you very much, Honorable Minister. Honorable Moletsane, are you available yet? Advocate, is Honorable Moletsane on the platform? If not, it does mean that...
Deputy Chairperson?
Yes, Honorable Arnold.
I'm going to take his question.
Yes, you may continue. You may continue.
Thank you, Chairperson. Minister, in light of the numerous challenges faced by the post office in paying out social relief distress grants, such as long queues on payday, outlets running out of cash, which means that recipients have to make multiple trips to the post office, which resulted in more costs incurred. By when can we expect faster intervention to relieve the post office from getting long queues where people have to take or where there is immediate access for the social relief distress grants payments? Thanks.
Thank you, Honorable Arnold. Honorable Minister. Honorable Minister. Is there an issue with the connectivity of the minister? Yes, unmute, please, Minister. Thank you.
Thank you very much, Chairperson. I think it's just the connectivity because it mutes itself without me touching it. No, thank you so much, Chairperson. I think that as I indicated upfront, we must be able to agree and accept the fact that the current challenges that have been faced by the post office really need myself and Minister Nchaveni to really make some serious decisions without any further delay. And I must indicate that the minister has indicated, we have indicated that we have to look for better solutions. The minister herself has been engaging, and the fact that there's also the post bank, which possibly could even have a greater responsibility when it comes to the payment of these social grants. I cannot put up, put an answer that is convincing at this point in time. Safe to say to the members, really honestly, we are looking for the best way, including if we need to bite the bullet where we need to bite the bullet and make decisions that are going to serve the people ultimately. The minister and myself have to do that. SASSA, on the other hand, has signed a long time ago an SLA with the post office, and we are insisting that we cannot have a good SLA signed off. But when it comes to our people suffering, going to the post office, borrowing money and finding no money at the post office, we've made the conclusion ourselves that we cannot go on like this anymore. But of course, we have to work together with the post office and the post bank and any other, including the Reserve Bank, including Treasury. We need to put our heads together and finally find a solution to this, because at the end of the day, we can't afford our people to be suffering in the manner in which they suffer. But in conclusion, also, I do want to thank the people for having looked for other alternatives and make sure that they easily access their money, as I indicated earlier on, through the banks and through the retail. Thank you, Chairperson.
Thank you very much, Honorable Minister. Let me first of all commend you for the fact that I know you are really championing the issue of the basic income grant. It is something that is very close to your heart, but also for the fact that you have been, according to your responses, we can hear that you have been struggling hard to make sure that there is improvement in the delivery of services, particularly from SASSA to the vulnerable of our communities. Lastly, let me wish you a speedy recovery and also appreciate the fact that in spite of, I know sometimes COVID can make you feel so out of the weather, but in spite of that, that you really prioritize the fact that you have to respond to the questions here. We appreciate it as the NCOP. And I also want to wish you well for the festive season. And I really, really hope I will see that smile very soon again. All the best. And with that said and done, honorable members, the House stands adjourned. Thank you. Thank you to the delegates and to everyone that is present at the meeting. We thank you very much. Thank you.
Thank you, Deputy Chair.
Thank you, Tebogo.
Recording stopped.
Unless, Advocate, there is anything else. But I think we have
Chairperson, we send
Recording in progress.
send our appreciation from South Africa to you in Madrid.
In Madrid, Spain. Muchas gracias, señor.
Grazie. Thank you very much.
Thank you. Right.
Thank you very much, Deputy Chair, for a well-conducted meeting.
Thank you, Honorable Governor. From me to you, thank you very much.
Take care of yourself. Be safe. Bye.
We test every 48 hours. I must test again today.
You better do that. Thank you.
Thank you. Right.
2 minutes
Recording
in there. Bye.
Honorable Dangor, how are you doing?
I'm fine, and you?
I'm fine.